where evidence turn to skills and strategies are translated into real tools that can be used in clinical, community, and daily practice. Let me welcome Dr. Sunil Kumar, Lifestyle Medicine Ambassador and leader at Personalized Care Institute. He also serves as a faculty to NHC England and European Lifestyle Medicine Organization with a special focus on stress and the clinical well-being. Welcome, Dr. Kumar.
Thank you. Good morning. Even though it says clinician well-being, how many of you are non-doctors? 1, 2. Yeah. So don't worry, it's not just clinician, it is relevant to everybody else as well. So I'll try to cover for all of you, okay? Now, since it's a workshop, I want you all to get interactive and get involved in the discussion. So I want you to move towards me if you can possible. If somebody is sitting in the back, just come in the front tables. Come to the front tables, please. And can I ask my colleagues here, do you mind coming this side? There's a table here, or you can sit here. Sorry. Yeah, sit here. Okay, are we ready to start? So, because I know there are not only clinicians here, so that's why I changed the title to just Burnout Workshop. Anyone here who has not heard about burnout? Nobody. Everybody has heard of burnout. Did you have any symptoms of burnout in your professional life? Anyone? You had, yeah. You had. Anybody else? You had. 5, 6, yeah. Any of you, do you mind sharing what exactly you had, the symptom-wise? What do you think burnout was for you? Anybody? Can I have a mic, please?
Lack of reasonable boundaries.
Okay, that's a good one. Anybody else?
Working long hours.
Working long hours.
No time for family or myself.
Working long hours forcefully or by choice?
By choice.
By choice, okay.
18 hours a day.
Fine, okay. Anybody else?
I enter a stage of depression.
Pressure,
Yep.
yeah, definitely. Yeah, that's another one. Anyone? This one here.
I would say chronic fatigue.
Chronic fatigue, that's a good
Yes.
one as well. Yeah, anyone else want to share what burnout meant for you
Dreading going to work. So
on Sunday night?
yes.
Okay, dreading the Monday, yeah, okay. Anybody else?
Bad sleep.
Bad sleep, yeah, because you had a very busy day, you couldn't sleep well.
Yes,
Yeah.
or
Okay.
awake very early at morning.
Yeah, so, okay. So we heard from all of you, most of you, the symptoms of burnout are different for different people. So you can't really measure, there are validated scales, but everybody refers to burnout in different way. So my objectives will be to discuss burnout and lifestyle factors that's going to contribute to its development and healthcare workers. Then we will look at the lifestyle choices we have and how it is related to burnout symptoms. Then we will evaluate the effectiveness of lifestyle pillars and positive psychology, which we can use it to combat burnout. Then hopefully at the end of the session, you should have an outline of your own personalized assessment and a plan to address the burnout. So burnout is nothing but a state of physical, emotional, and mental exhaustion. 3 things. So all the symptoms you described, will they fit in these 3 things? Does your symptom fit in this mental exhaustion, physical exhaustion, or emotional exhaustion? How about you all? Yeah, it does do there, sorry. It's described as psychological syndrome. How many of you agree it's just a psychological syndrome? No? What do you think is, what else we can add to it?
There's physical components as well.
Exactly, yeah. And anything else anybody want to add? Yeah. So it does involve your personal well-being, your well-being with the family, with the community, with everybody else as well. So it is not just a psychological syndrome as people say, even though it's work-related, you take it to home as well, you take it to everywhere you go. And it's particularly common in the caregiving professionals like doctors, teachers, and social care workers, ambulance drivers, paramedics, everybody. It's highest in paramedics, next comes to other clinical doctors. So when compared to the general population, we are at a higher risk. So we have got already one more risk factor added to our profession. Now, do you know of any profession where you enter the profession first year of your life with a risk of getting 60% burnt out within first year of your work? Do you know any other profession apart from medical profession? No? So we are starting our burnout journey from that stage. So more you get into the work, more you get involved, it can only go worse unless you look after yourself. This is a stress performance curve. Anybody knows? I mean, most of you probably know it. It's called Yarkes-Dodson law. If you look at on the y-axis, there's a performance. On the x-axis, there is stress level. We all need some kind of stress to perform well. That's a good stress. Yeah? If you're not stressed about your exams or the work you do, you can't perform well. So you need to have that good stress. So as the stress level increases, your performance gets better and better. It goes to the stage, to the peak, where you are optimally performing very well, which is your flow state. Yeah? Once you start performing, when the stress level goes beyond that, you get into fatigue, burnout, any other health problems. Okay? So this curve is relevant at every new thing we do. Once you've come out becoming a medical student or a nursing student or psychology student, whoever it is here, once you get into the profession, first year of life, you're building this curve to reach it to the optimal performance. But it's a steep curve, it takes some time. So you are prone to get stressed, not actually burnt out yet, but you get prone to get stressed. We have to differentiate between what is stress and what is burnout. A lot of us use the word interchangeably. So we should know, are we stressed or we are burnt out? So a lot of symptoms you described could be stress. So what is stress? It is characterized by over-engagement. You want to really perform well, you want to do well, whatever job you've taken or a project you've taken. So that is characterized by over-involvement in that job. And then emotions are very much overactive when you're stressed. But if you go to the burnout, once you reach to the stage of burnt out, you get disengaged. The same work, the same flow state which you were in before, you don't want to go there. You don't perform to the optimal performance when you reach to burnout stage. So you get disengaged. Then your emotions get blunted. Your compassion to the patient gets blunted. You're not bothering about what patient is telling you emotionally. So you're reaching that stage from stress to burnout. Then next is in stress, it produces urgency and also the hyperactivity as well. You want to perform well, so you always doing things, you're rushing to the things, you're working hard, losing some sleep, and all those things you're doing to perform well. So that is still stress state. But in burnout, whatever you do, whatever rest you've taken, you feel helpless. And you feel a hopelessness as well, that you think you can't do the job anymore and you are not fit for the job anymore. That's what you think. Then coming to loss of energy in stress, in burnout, you actually lose motivation to work what you came up with to initially into this profession. You lose your ideals, you lose your hope. So I can ask some clinicians here, why did you become a doctor? Anyone wants to answer this question? Anyone? Why you wanted to become a doctor before becoming a doctor? You have got an answer for yourself? Have you got answers for yourself? You don't have to tell me. You want to tell something? Yeah, go on.
Actually, during my time, I hate to be a teacher. It was the only field for a female, so I jumped to. to
Okay,
medical field.
but do you know why you wanted to become?
Also, my father.
Was a doctor?
No.
Okay.
He liked to,
For you to
especially
be-
for the female, to be in positions,
Yes.
and at my time, it was a high rank
Okay.
work. So I immediately jumped to the medical
Okay.
field.
But you were enthusiastic. You want to become happier. You want to become a
Yes.
doctor.
No, I was enjoying
Yeah,
my
yeah.
time.
And how long you have been in this profession now?
About 20 years.
20 years.
Yes.
Have you got the same answer to your question now? Why you wanted to become a doctor?
Even if it's come the time, I would be a doctor
Yes.
also. Yeah.
I want you all to ask your why. Any profession, not doctor as such. Anytime you get in trouble, you get fatigue, you get physical exhaustion, emotional exhaustion, go back to your why. Because most of us enter this profession for caring, for compassion, for everything else. So as long as we keep on reassessing ourselves why we came into this profession, that will give you some buffer to prevent having burnt out. So please take your time, write your statement why you came into this profession. That will help you to safeguard. Nobody else can help you, it is you. But your answer is that why I wanted to become doctor, I am not that person anymore. That means you have to think something else. You have to cut down your hours or you do something else. Yeah? Oh, sorry. So again, stress leads to anxiety disorders more, and burnout usually leads to detachment and more depressive symptoms. Although stress primarily damages physical symptoms like chronic fatigue, you lose sleep and all those things in stress to start with, but in burnout, it starts with emotional damage first. And then if you forget the table, just remember stress is when you are drained according to your routine work. For example, somebody might be working 12 hours a day or 15 hours a day or maybe less. If you feel stressed or any burnt out symptoms, after adequate rest, when you come back on the next day, if you feel completely in your flow state, that means you were stressed, you were not burnt out. Yeah. But if you're not able to recover with adequate rest, holidays, or whatever, that means you have to look after and look at yourself and see, are you stressed or are you burnt out? So burnout is not an acute problem. It's a chronic problem. It starts, we all have probably, all of us sitting in this hall now, we are in one of these stages. I want you to sink in that we all are in one of these stages. Sometimes we realize, sometimes we don't realize, sometimes we blame it to something else, sometimes we blame it to our own fault, but we are in this stress because 60% of the risk we have to start our professional life, imagine how it builds up as we grow. So first stage is a honeymoon stage, enthusiasm is there all the time. You want to really prove to the world you're the best doctor, you came into this profession to do something good. That's where the stage one starts. The problem with stage one is you get over involved. There is no adequate rest. If you don't realize that, then you go into the next stage chronically. Next is onset of stress. You get stagnated. I'll go to the symptoms in the next slide more. Then there's a chronic stress. You get frustrated. Then stage 4 is apathy, burnout. And stage 5 is habitual burnout. In habitual burnout, you reach to the stage where you really need interventions from professionals like psychiatrists or occupational therapists. All those people get involved at that stage. The good thing is that once you realize whichever stage you are in, you can reverse back by applying good lifestyle measures. So if you see the physical exhaustion, the physical symptoms start first from stage 2, then you start getting more emotional exhaustion and other things later. So honeymoon phase, You are satisfied with your job. You are committed to the job. You do accept responsibility more than you need to or want to. And there's compulsion to prove yourself in the profession that you are come, that you need to be doing well. You want some appreciation, good feedback, reflection. And free flowing of creativity is there at that stage. It's a good stage to have. And there is a good optimism, and you try to produce good productive results as well. Now, once we move to the onset of stress stage, it takes about months. It is not immediately. It takes about months from stage 1 to stage 2. If the chronic stress is persistent, if it is only episodic, you might come out and go back, come out and go back. But the same stress is persistent, you get into stage 2. Then you get all these symptoms, all cardiovascular symptoms, inability to focus, anxiety, irritability, avoidance of decision making, reduced sleep quality, lack of social interaction, headache. You start producing your lower productivity as well, and neglect of personal needs. Once you start noticing that you're neglecting your personal self-care, you have to stop and reverse it back to stage 1. Any one of you experience these symptoms? First stage 1 and stage 2? One. I think most of you experience these symptoms at some point. So sometimes, as I told you, the cause is chronic and every day it's there, then you have to look at it. Then coming to stage 3, it's a chronic stress, where you got persistent tiredness, fatigue, all those symptoms. Then chronic exhaustion, procrastination, cynical attitude, aggressive behavior, apathy, social withdrawal, even family withdrawal sometimes, all that happens. Then stage 4, this is where real burnout starts. You are obsessed with your problems, not with the work you want to do. Then chronic headaches, chronic GI problems, physical symptoms, self-doubt, all systematic symptoms you get. If you don't change even that stage, you will get into the stage 5, which is habitual, which is chronic sadness, chronic mental fatigue, chronic physical fatigue, depression, and suicidal tendencies as well happen at this stage. It's all chronic, and it takes about from stage 1 to stage 5, it takes about 6 months to 8 months, maybe more. Any questions so far? Anyone? Yeah. Is getting a mic.
Thank you very much for the opportunity. I'm just wondering that in my experience of interaction with very experienced doctors for the past many years, like maybe around 8 to 10 years, they are becoming more and more they are becoming less empathic. Why? Like, I'm surprised the more you get experienced, the more you should be able to show empathy with the client. But it seems like just a business, another business, yeah.
That's what I'm saying. The first year when we start our job, we already prone for 60% of burnout. Not only, I think yesterday's presentation showed us that 56% of the resident doctors get into burnout here in this country. In America and UK, it's same, between 55 to 60% is the average burnout rate. First year of a medical school, first year medical job. As we progress, the demands, the stress of the job, the administrative burdens, the systemic changes, all this add on. So as we progress, we might be very knowledgeable, very skillful, but we are not performing in our optimal zone. We try to slide back into this side of the curve.
Yeah, and it becomes drastic when it's a psychiatrist, like.
Yeah, obviously, if you go into a chronic state, you need some interventions. But once you realize that adequate rest is not bringing you back to your optimal performance of your day, then you should sit down and think, am I putting more time, or I'm putting more energy there, or I'm not taking anything restorative activities. So that's the thing. So you have to, no government, no policies will come and look at you at this way. You have to look at you this way. We do audits of simple things in hospitals every day, every time. Why can't we audit ourselves? Why can't we appraise ourselves yearly, 6 monthly, or whatever? 1 hour it takes, sit down and think what you're doing. Then you'll perform better. Once you come back to the optimal flow state, you're performing still better again. So when it is alarming, when you get some symptoms, when it is alarming for you to think why I should go. If you get any of these symptoms for more than 2 weeks, you have to think what I'm doing. What's first symptom is persistently diminished mood, loss of motivation, feelings of guilt or worthlessness. We all feel this once, twice in a day, or maybe in a week or month. If it's persistent for 2 weeks, more than 2 weeks, you have to sit down with yourself again. You should love your company more than anybody else's company. You should sit down every time. Okay? And persistent social isolation for 2 weeks, changes in relationships. You'll start noticing you're not interacting with your friends, work colleagues the way you wanted to before, the way you did before. If it happens consistently, that means something is wrong. Life interfering anxiety symptoms. We all feel anxious with some things and all that, but it's interfering in your life. You're not eating well, you're not sleeping well, you're getting some suicidal ideations or something else. That means something is wrong. Use of alcohol, obviously it's not here. Use non-prescribed medications, illicit substances. If it becomes, it's a new thing in your life, it started because of no reason, which means you are looking for some way out to address these symptoms. Then sustained decline in your function, physical function, emotional function, spiritual function. You start going to your prayers less, you don't want to get involved in prayer. All those things will help. You should give a red signal to look into yourself again. Changes in your eating pattern and or weight loss, even weight gain, everything is a part of this. Because when you're very much chronically stressed, stress eating, all that helps to gain weight as well sometimes.
Sunil,
Yeah.
Dr. Sunil, please here.
Interact. Yeah. Okay, I do, yeah.
السلام عليكم، صباح الخير جميعا، حياكم الله. أنا الدكتور مشعل النعيس، رئيس اللجنة العلمية في مؤتمر ضمن نمط الحياة. طبعا معنا الدكتور سنيل، هو أول متحدث أو في ورشة العمل اليوم. حياكم الله زملائنا من جامعة حائل، صح؟ أي كلية؟ أيوة نعم، تمريض. من معنا كليات ثانية؟ إدارة صحية، حياكم الله. طبعا نوجه التحية والتقدير لدكاترتنا وبروفيسوراتنا من جامعة حائل، ما قصروا على حضورهم وتشجيعهم للطلاب. جامعة حائل هي جزء لا يتجزأ من الداعمين الرئيسيين لمؤتمر طب ضمن الحياة. The University of Hail, they are the main supporter for the lifestyle medicine conference in Hail every year. I appreciate their presence, and they send all their students here to enrich the workshop. Thank you, Dr. Bender Saif. Thank you, Dr. Bagawi. Thank you for all your faculty, and I appreciate your presence. I will help Dr. Sunil, and I will moderate this workshop with him, so we'll be more interactive with you. I will translate some word also. بسأل أول سؤال لعيالنا علشان يصحصحون كذا الصباح. I will ask the first question for our student and our colleagues إن شاء الله in the future. دكتور سنيل ذكر الفرق بين القلق والبيرن اوت، الاحتراق الوظيفي. دكتور سنيل he presented the difference between stress and burn out.
Shall I go back?
So I'm asking, yes, you can go to the slide. This is a very important point. أنتم الحين يمكن ما عندكم احتراق وظيفي ولا عندكم احتراق جامعي. مدام الدكاترة هنا موجودين نسأل شو. ارفع صوتك.
اقول دام عندنا الدكاتره موجودين ومع الاجتهاد اللي احنا مجتهدينه، ما عندنا لا احتراق وظيفي ولا احتراق دراسي. دامك تمشي على جدول واضح ما راح تضيع.
جود. تعرفوا الفرق بين القلق والاحتراق الوظيفي او الاحتراق الدراسي او
القلق يجي من شيء مستقبلي، فما عندك شخصيه تقلق من شيء مستقبلي. من الاحتراق حتى تفكر انه اوكي راح امر على شيء جديد فتبدا تقلق فيه، والقلق اصلا يؤدي الى الاحتراق. كثره القلق.
Okay, can you please repeat this slide, Dr. Sunil? I will translate again for them because we have to differentiate between when we are stressed and when we are burnout. Because when we are stressed, it's different in our workplace, some people, they are not even tolerate to be stressed.
Yeah.
So they will change the workplace and they will make a problem in the workplace. يعني في بعض الموظفين لما يحس بالقلق يغير مكان عمله أو يغير كليته. لكن لما تكون بيرن اوت يعني انت محترق وظيفيا او في يعني حاجات اخرى ذكرها الدكتور وبيعيدها الحين لانها مهمه جدا اننا نطلع من ورشه العمل اليوم احنا فاهمين ايش الدفرنس. اوكي.
So stress is acute. It comes in minutes or hours or days. The burnout is chronic. It develops over months. So first difference is when you are stressed, you are characterized by over engagement. You want to do the work more. You want to study, you want to impress your professors, or you want to impress your work colleagues or other students or anybody that matter. But you're burnt out, you're not bothered about anybody what is judging you or not. So you are completely disengaged from your activity or your work. That's the first difference.
كلير واضح؟
هي واضحه لكن لو تشرح لنا اياها.
اسال.
لا لو تبي تشرح لنا اياها انت من شرحك.
This is the first one.
طيب, this is the first one.
Yeah.
Go to the second one.
Second one, your emotions are overactive. You are in a high energy state to do things. So you're acting overactively. You want to talk to everybody. You want to do things. You want to take help from others. But you are burnt out. Your emotions are completely blunted. If you're a doctor, you won't see the patient's emotions coming to you. You're just mechanical. You don't know how to associate with them. So that is become emotions are blunted.
Okay.
Yeah, next one is obviously stress produces urgency and hyperactivity. You want to urgently finish the task, finish the homework, finish the activity, or finish your clinical projects, anything like that. And you're overactive, yeah?
ايه فعندي معارضه بسيطه. الاحتراق الوظيفي يجي من الشخص اللي يجيك يتوظف من ناحيه انه خلاص هذا شغلي، من ناحيه التمريض والصحه ما تاخذها كخلاص وظيفه والشخص اللي قدامي كانه ورقه بوقع عليها ويمشي.
طيب
فحول الوظيفه نفسها الى حياه. هذه حياتي انا من حقي اعيش. فحول المستشفى الى يعتبر منزلك الثاني اصلا. فيوم تعامل شخص عامله كانه اخوك كانه اختك.
صحيح. طيب وذكر الدكتور رابع نقطه لوس اوف انرجي في الستريس. اذا كنت عندك ستريس فانت تفقد طاقتك او خلينا نقول
طاقه نفسيه
الطاقه اليوميه. لكن في لما تكون انت محترق وظيفيا او جامعيا فانت تفقد الموتيفيشن وحتى الهوب الامل في المكان هذا، تفقد كل شيء. فهي البيرن اوت مرحله اخطر شوي او متقدمه اكثر. فما ودنا احنا نصل دائما ان نكون بيرن اوت. الستريس ترى شيء طبيعي انه كلنا نقلق في عملنا، في مؤتمر، تنظيم مؤتمر، في لما اروح المحاضره الصباح، لما اشغل السياره واوصل الى مكان عملي، احنا لازم نكون يعني قلقين ومنتبهين. لكن لما توصل اوفر احيانا المكان سواء احتراق وظيفي او اوفر ستريس، هذا اللي احنا نحاول نفرق بينه ولا نصل الى هذا. Okay, the next one lead to an anxiety disorder.
Yeah, stress leads to anxiety disorders. You become more hyper anxious because you're doing something to finish the project or finish deadline. So you're more of that hyper anxious state. But in burnout, again, it leads to detachment. You don't want to talk to your family or friends, anybody. You're completely detached from everyone and you feel hopeless.
نرجع نقول ستريس يسوي anxiety disorder يعني أعراض قلق. أما البيرن أوت يؤدي للإحباط والاكتئاب. أي أخطر؟
اكيد الاكتئاب
أي أخطر الستريس ولا البيرن أوت؟ بيرن أوت. فهمتوا الفكرة؟
اي فهمناها.
عندكم سؤال شباب؟ لازم تسألون، هذه ورشة عمل. حضروا سؤال أثناء ما احنا نتكلم بعد شوي. طيب احنا خلصنا من الطاولة لأن احنا بنمشي على الطاولات هذه كلها. فكلنا يحضر سؤال. الدكتور موجود جاي من مكان بعيد علشان احنا اليوم نستفيد من وجوده ونستفيد من علمه يعني. Now they said we are a little bit
understanding.
We can differentiate between stress and burnout.
Very important slide.
Yeah, very important slide.
Yeah.
Any questions?
Anybody else wants me to repeat anything, please do ask me.
Because we will move slowly with the slides
yeah.
because very important information here in every slide. في سؤال؟
Any questions from anybody? Anyone wants
قلتوا
to ask?
معنا الصحة العامة هنا؟ صح؟ بس التمريض اسألهم ما شاء الله عليهم صح العام. طيب دكتور بندر.
السلام عليكم. الله يعطيكم العافية على الحضور. الدكتور أعطى نقاط أساسية للفروقات الأساسية بين الستريس والبيرن اوت. تمام. أتوقع أن الصباح يبي لهم شوي اكتيفيتي. إذا تسمح لي بس شوي. ممكن الكل يوقف. اوقف.
Because there's still
اوقف.
yeah, we have to do some physical activity in the morning.
It's early in the morning, right?
Please.
It's early in the morning. So I think everyone still did not shake out, the sleepiness.
Nice. Yeah.
Okay, so take a bit, take a
Some do
deep breath.
exercise.
Yeah, deep breath. Yeah. Inhale.
Come on, Michelle,
exhale.
join.
Okay.
Show some breathing exercise.
There is. Inhale. Yeah.
Yeah, you can do some now. Yeah.
Yes. They are all health professions. So
Everybody can speak English well? Okay.
Yes, go for it.
All right, everyone. I invite you to come into your body in this moment. Really just starting to notice. If you feel comfortable closing your eyes, go ahead and do that. And if not, just softly gazing at the floor, but just starting to notice. Noticing your breath as it moves in and out of your body. Letting go of any thoughts of anything that's already happened in the day or in the past. Can you just set that all down? Not thinking about the to-do list that awaits you or anything that's going to happen next, but being right here, right now. Noticing your breath as it moves in through your nose all the way to the top of your head. Letting it out all the way to the bottom of your feet. Maybe placing a hand on your chest and a hand on your belly. As you breathe in, feel your chest rise as you breathe in. Belly expand as you breathe out. If thoughts come, let them come and let them go. Just thinking soft as you breathe in, belly as you breathe out. If your mind wanders, know that it's in your mind's nature to wander. Come back to that breath. Soft as you breathe in, belly as you breathe out. Moving both of your hands to your heart. Noticing your heartbeat. Knowing that this heartbeat, this breath, is what allows us to be here right now. And as long as you're breathing, you're safe and you're well, and there's more right with you than wrong with you. And you may not be able to control anything in the world around you, but you can control your breath. And so this breath is our superpower. And it allows us to control our nervous system, moving us from sympathetic fight or flight into parasympathetic rest, relax, digest. Continuing to breathe on your own, knowing that you can come back to this breath whenever you need it. Breathing in love and tenderness and kindness and care and compassion for yourself, just like you give to so many people in the world around you. Can you give that all to yourself in this moment? You are exactly where you need to be right now. Reconnecting your mind with your body, with your breath. You're safe. You're well. This breath allows us to be here together, to interact with each other, and our whole planet needs this kindness and this compassion and this parasympathetic nervous system. So one more very deep mindful breath in through your nose, out through your mouth, and then slowly opening your eyes, starting to come back to the world around you, maybe looking around and smiling at each other, recognizing our own humanity. We're often caring for everyone else and we're forgetting to care for ourselves. So I ask you to just be so kind to yourself and so compassionate and proud of yourself for showing up today to take this moment for you.
Thank you very much, Doctor.
Thank you, Michelle, for this nice exercise in the morning.
So this is one of the steps is to stress relief during the morning. You know, to be positive. كونوا إيجابيين قبل ما تروحون. لا تحمل أعبائك وتروح الدوام. ممتاز. الصحة العامة، تمريض، التخصصات الصحية كلها فيها عبء. It's stressful.
Yes.
Health profession is stressful.
Yes.
فلذلك لازم الواحد يعرف إنه عنده مشكلة أساساً عشان يحل المشكلة. If you don't know that you have a problem, you will not solve the problem.
You have to name the problem, yeah.
Yes. فنبي نسمع من الطاولات. الآن ما شاء الله الجانب الأول التمريض تشاركوا. وين الصحة العامة؟ الصحة العامة.
ارفعوا ايديكم اللي عنده سؤال يشارك. اي مشاركه مقبوله يعني.
من افضل الطلاب والطالبات المتميزين البوست جراد. They are postgrad students, okay. So I think I don't stress them in my class, okay? but I think they have the most أكبر عبء للضغوطات.
Yeah.
So my question is, sometimes stress pushes us to our best achievements. When to know stress is positive or negative to our life decisions?
I'll come to the next slides anyhow, but as long as you know your optimal state, you should know in every project, in everything you do, there is when you stress yourself and you're 100% productive, if you start stressing a little bit more than that, you will start reducing your productivity, start reducing the way you want to do the results. So that is the time you should think, okay, no need to take more stress. I'm best here to come back here. Any project, any work you start, anything.
Thank you.
Thank you.
So we took male, nursing,
yes.
Female, public health.
Yeah.
We'll take female nursing.
Okay.
Okay.
Anything.
طالبات تمريض. وش الأعباء؟ إيش السؤال اللي عندكم؟ وش الفرق بين الستريس والقلق أو الضغوطات وبين الاحتراق الوظيفي؟ وش اللي فهمته؟ نبي هذه ورشة عمل وليس محاضرة، ورشة عمل. فنبي نسمع منكم.
في أحد عنده تعليق أو سؤال؟
هنا الطاولة هذه.
دكتور سأل جاوبوا لازم.
هذه الطاولة.
هذه الطاولة بنت هذه. الله يعينكم جاوب. الله يعينكم هذا الدكتور يقول لازم.
الفرق بين الستريس والبيرن اوت، الستريس راح يكون اقل من 2 weeks وكلنا نعيش فيه الستريس، اما البيرن اوت راح تكون كرونيك اكثر من 2 weeks، فراح نفقد الهوبلس فور البيرن اوت.
ممتاز. طيب قبل ما هذا، انتم كطالبات الان طلاب الجامعيين باي مرحله تحسوا نفسكم؟ هل ستريسفول؟ هل وصلتوا بيرن اوت؟ عشان نعرف احنا هنا في الزملاء والزميلات ما شاء الله اعضاء التدريس، احنا نوفر لكم دائما بيئه صالحه، بيئه خاليه من خلينا نقول تكون وان فاميلي. لكن وش المرحله اللي انتم تحسون فيها الان بكل شفافيه في الزملاء هنا يعني.
طيب اذا سمحت دكتور بندر، دكتور سنيل، they said the answer that the stress before it will take 2 weeks and the burnout more than 2 weeks. Is it
Yeah,
right?
it
Or
comes
I
slowly.
need your comment on this,
Yeah.
the duration of the stress.
The burnout takes in months. You start noticing symptoms in first month, second month. It might not come all symptoms together. It'll start with the onset of honeymoon phase where you really want to do well and all that. But the same symptoms stay for more than 2 weeks with all the measures you've taken to look at it. That means something is wrong.
So it maybe happened the burnout after 2 weeks.
No, it doesn't happen after 2 weeks. It happens in months. But the symptoms will start, if they're persistent for 2 weeks, it's alarming for it. It's a red signal to go and check is something which is causing from work stress or personal stress.
So الاحتراق يجي بعد أشهر يعني من الستريس.
I don't need a
مو
sorry.
أسبوعين. أسبوعين هذا ما أدري عاد يمكن في بيئة عمل ما نعرف إن شاء الله ما هي عندنا. إيه بس إنك توصل الاحتراق بعد شهور. النقطة الأخيرة هنا الدكتور ذكر primary damage is physical stress.
Symptoms like fatigue
yes.
or
While in burnout primary damage is emotional.
To start with. But
يعني في الستريس ممكن يأثر على الفيزيكال الجسم، أما في البيرن اوت يكون أيضا على العواطف، يعني يدخل في اكتئاب ومشاعر عاطفية أخرى.
باقي الصحة العامة.
في سؤال هنا إذا تسمحون لي، سؤال.
Hello, good evening, everyone. I am bridging student in حائل University. Also, I am a senior nurse before. I want to ask one question. Why the difference between old generation and the new generation about our friends before? Old generation like me, I am 20 years in the job before, and already we have the burn in the work. Yeah. Since a long time, the difference is the situation and everything, not like facilities now. But a lot of our friends, new generation, them quit.
Yes.
Them work.
Because tolerance level is low.
She's talking about tolerance.
Yes.
Yeah.
Tolerance level is low, and they don't differentiate between the stress or burnout or anxiety, because they usually put at anxiety levels, which is nothing but stress.
Yeah, but them leave them job. Them quit. A lot. I am from Tabuk. There is a lot of the people there. Them quit the job and them say, okay, I will go to continue my study.
Yeah.
But why? In this time, it's like that. Why it's more stress on the people?
There's no. Again, we have to empower them, educate them that it is not burnout. It's more of a stress. But current generation is much more into self-care. They look after better than ourselves. They want to do good for themselves more than anybody else. That's why they might understand it's not good for them, they leave it.
Doctor, maybe will be surprised, but a lot of our friends who have a bridging student, them eat a lot of ashwagandha in the exam time and like that. And a lot of them eat also melatonin to help them to sleep.
Yes.
Is this a solution for our cases or not?
Yeah, all lifestyle changes are solutions. I'll come to it anyhow. Yeah?
Okay, thank you.
Yeah.
Thank you for this interaction. We will continue the slide now, and we will go back lesson. ركزوا مع الدكتور في السلايدات القادمة وراح نرجع لها إن شاء الله. بعد اكتبيه نبي نكمل الآن المحاضرة أو ورشة العمل. إذا عندكم أي أسئلة أو استفسارات just write it down and we will discuss it later on. نبي نناقشها إن شاء الله. ما راح يطلع الدكتور اللي أنتم يعني راح يجاوب كل أسئلتكم وكل ما يأتي على بال. يعطيكم العافية. We'll continue now.
Okay.
Thank you.
Anything they want to know from this slide?
Because we have only 40 minutes now left, so we have to catch up to finish.
Yeah.
We will discuss everything in the second discussion session.
So how can we measure burnout? Again, a lot of validated scales are there to measure burnout for research purposes. Do you know when the burnout term was coined? How many years? Take a guess. How many years ago that the burnout term came into vogue? Anybody? 20s? 80s? Anyone else? Freudenberger, there was a psychologist who introduced this term in 1974. which is just 50 years old, the burnout concept. But do you think people before didn't get burnt out? They did. There are different names for it, but they got burnt out. But still, until Christina Maslach, who developed the Maslach burnout inventory validated tool, she in 1990s, this tool came to research. So obviously, if you see in the research literature now, number of hits on PubMed went quite high from 1990s because there was nothing there before. That doesn't mean people didn't get burnt out. So the answer to your question is people got burnt out throughout every ages, every decades before as well. So it was there with different terms. But burnt out for our generation came in 1974, got validated with the tools, with this Maslach burnout inventory. She was a Christina Maslach. She was the one who developed this. Again, lot of these validated tools measure workplace stress. So do you think we only get stressed at work? No. We have got personal stress, social stress, domestic stress. Every stress is there, but it only measures that. So again, we are missing out on something which is there. So it measures psychological components as well. So, but there is more to it than psychology. Now, Christina came out with different set of questions for different professionals as well, for teachers, for nurses, for doctors, for medical students as well. And every research on burnout has shown that using this scale, we are between 55 to 60% burnout rate. Compared to the general population outside, they are around 40 to 50%. We are higher, but they are, depending on what work they do, they get less burnout. So this is an example of, this is a scale which looks at 22 questions. If you look at the questions, we all already discussed what we are doing. And those are the three things they measure: emotional exhaustion, depersonalization, personal accomplishment. Okay, this slide is very important. The first time when we defined you about the burnout, we said it's a psychological syndrome. Okay, psychological syndrome, but it is actually damaging you personally. Everybody agree? Yeah. It actually causes repeated episodic or chronic stress leads to burnout. Then autonomic nervous system activation happens. What Michelle has shown us is to decompress that bit of the stress to start with every day. And then HPA axis activation happens, cortisol rises, which is not good for us. And DHEA, different type of cortisol, reduces. More of that DHEA, more resilient we are, but that reduces as well as cortisol increases. So we're getting burnt out, we're getting low on resilience as well. Now that is okay as far as at work stress. We can come out of the work, we said, okay, I don't want this work, I'll go out. If we keep in the same occupation which is causing these problems, you get into metabolic problems. Your brain changes happen anatomically as well as functionally as well. Your hippocampal frontal volumes reduces. Your neurogenesis and reduces. Functional decoupling happens between limbic and higher cortical areas. These are the areas you need most when you're getting burnt out to come out of it. It's a paradox. Obviously, it is affecting the same areas where we need it to work more on that. You can imagine. And cognitive function reduces. Immune system, you become chronic pro-inflammatory state in the body. Without, if you're doing everything well in life, nutrition good, physical activity good, everything else good, only workplace stress can put you into pro-inflammatory state, which can lead to the systemic disorders like chronic diseases. So you can imagine we are one extra risk factor working in healthcare, in addition to the general population, to get diabetes, hypertension, blood pressure, all these symptoms, all these diseases. So it is not just a psychological disorder, it is a physiological metabolic disorder as well. Earlier we understand, earlier we look into ourselves and self-care, we will not be able to come back from these changes. I'm going very slowly. Anybody has any questions here? Understand? Anyone? No. Also, there is biological mechanisms. If you measure their cortisol patterns, there is a 30% variation from normal diurnal rhythm, which is very bad. Then blunted cortisol awakening response when you become chronically burnt out. And there is CRH receptor downregulation in chronic stress. So you can see it is going to the cellular level, mitochondrial level, it is going to every level, stress. And inflammatory markers, IL-6, interleukin-6 elevates 40% above baseline in chronic burnout. Yeah, question, sorry. Okay.
Thank you, Doctor, for this presentation.
Yeah.
I have one point.
Yeah.
Before we get the burnout, we have personal adaptation.
Yes, resilience.
Yes, resilience, personal adaptation before to the burnout. Also, the social support, institutional social support, all of this may be interact before reach to the burnout.
Yes.
So we have to concentrate on this in this point. We have to encouragement of the personal and social institutional support before we can.
That's
go
what I'll
the
come to the
burnout.
next slide. Yeah,
Yes.
I'm coming to the next slide.
Okay, thank you so much.
Thank you. So inflammatory markers are raised, autonomic nervous system is unstable. We know about all these things. So why do we think we have got unique challenges compared to somebody who's working somewhere else in a shop or in anything else? Why we healthcare workers, why we got unique challenges? Agree with this? We got higher exposure to trauma, to stresses. We make high stakes decisions because we're dealing with somebody's life. We're not repairing a refrigerator or we're not making machines or anything like that. We're dealing with somebody's life. So we're always in the high exposure to stresses like trauma and all this. Then emotional labor. Is it on timer or something? I don't know. So there's an emotional labor of caring for others. We have been taught to care others first. Somebody, I think Dr. Nasreen mentioned in her presentation, even if you want to take your own personal break, it could be toilet break or they want to drink water or eat food, you will stop. If a patient is in front of you, you want to do the patient care first, then you go to your own care. We have been taught that way. So self-care comes first. Obviously, you have to balance where you have to stop and where you have to do things. Similarly, there is a pressure to prioritize others' needs, as we know. It could be cultural expectation from the specialty you are in, plus the culture of the land as well. And stigma around acknowledging struggle. Nobody wants to say, and especially doctors don't want to say, I'm struggling, I'm stressed, or I'm burnt out. In America, there's a Medscape report comes every year. They look at all the medical community members of the AMA, and every year there's a consistent result of burnt out between 50 to 60% throughout. The main problem which I've seen there is about 60 to 70% of the doctors have said, we know we're facing, but we don't want to tell it outside. So that stigma is still there, even now. Sorry. There's the individual modulators and enhancers of burnout. Like you can protect, what are the protective characteristics and what can enhance. Agreeableness, like if somebody is telling you something, okay, agree, it protects your burnt out. Conscientiousness, like you look into all social factors, everything else together, then you are actually protecting yourself. Then extraversion, openness to experience, positive psychological capital. I don't want to go into depth on all these things, but these are the enhancers. I mean, these are the protectors of burnout. And if you are type A personality, if somebody else is controlling you at the job or at home, you are prone to get burnt out. And alexithymia, emotion-focused coping, all these factors will do that. There's a Stanford model, which is called professional fulfillment model. We always talk about burnout, but what is the antidote for burnout? If you are 100% fulfilled in your profession, yeah, So that's the main index you should look for rather than looking at burnout side. So Stanford came with this model. I don't want to go in details, but it looks into three things: the personal resilience, efficiency of practice, and culture of wellness. So there's organizational component, there is personal component, and there is efficiency of your practice, skills development and knowledge development and all those things. All those three factors come into picture. Any questions so far? I'll come to your point anyway.
I have a question. It's we always, well, yesterday we were talking about culture. And
Yes.
we were talking about, the difference between culture and things like this. And most of these models are like Western. Okay. So how can we, like, when you talked about wellness, okay, wellness is well known in the US and, in Western countries, but can you go more like in depth on wellness, of the perspective of wellness? Because
I'm
when
going
we
to
talk about wellness here, people don't understand the concept of wellness.
Yeah.
Like in Saudi culture and in Arab culture, it's different. And I think maybe some of my colleagues agree about this. So if you don't mind, please, if you
Wellness,
can.
yeah. I mean, obviously, wellness is defined differently in every place. As long as you're optimally functioning yourself physically, emotionally, and spiritually, and you're happy with yourself, that's wellness for you. It differs from land to land. So that for me, that's wellness for me. If I use the same definition as somebody is using in America and UK, it doesn't fit to some lands. As long as in these three components, if you're well, you're doing well optimally, that's well. We can't measure with the parameters, blood markers, nothing. So it's about feeling. I'm not going into details there. Also, there's a Mayo Clinic Wellbeing Index dimensions. Again, as I said, we all look into only burnout, but Mayo Clinic is looking into 5 more extra factors, which is meaning in work, severe fatigue, work-life integration, quality of life, and suicidal ideation. So these dimensions cover most of the things. Yeah. Now coming to work-life balance, how many people use this word work-life balance? You all use work-life balance. Sorry? Exactly, yeah. Do you like integration or balance? When you talk about balance, you always think both are 50-50, which means you're working 50% of your time and you're at home 50% of the time, anything for that matter. We never achieve that balance. Nobody achieves that balance. You have to integrate it. That's a better term to use. There's a well-being index, which I was talking about before. Okay. Now, Maslach has defined burnout with these three on the left side. It's exhaustion, it's a compassion fatigue, and loss of purpose. Now, if you look into, we have 3 bank accounts, not the money one, I'm talking about here. Physical bank account, and like physical energy bank account, emotional energy bank account, spiritual energy bank account. We go every day to the work because we're spending the money which we're earning to put it back, deposits into the bank. We go every day to work so that we can get money keep coming to us. Similarly, there are 3 bank accounts when you're working at workplace or for your life. You are using all those bank accounts every day for work, for personal, for social reasons, or occupational reasons. So if you look at physical energy, it's your fundamental drive to get up and go for the work every day morning. If you're not going happily in the morning, just I want to go and work, which means something is lacking in that bank account, you have to start refilling it. Physical energy, like activity, nutrition, all those things come there. Then emotional energy, it's your capacity to be emotionally present for yourself, for family, for community, for patients as well, and being compassionate to others. Spiritual energy, your connection to the deeper why. It could be a religion, could be faith, could be anything where you get connected to some higher purpose. The 6th pillar, one of the pillar of the social connectedness has been changed to connectedness now, where they talk about your connection to yourself, like a horizontal connection, yourself, family, community, that's a horizontal connection. Then the nature. Horizontal connection.
Dr. Sunil,
yeah.
We have 5 minutes left for that.
Is it okay?
Okay.
Okay. So yeah, those connections, vertical connection as well, like faith and spiritual as well. So you get all these connections you have to work on every day. So coping is, we use these three words again, like anything. Coping is managing our adverse situations. Resilience is bouncing back from the adversity. And flourishing is growing in the face of adversity. Now, all the things which we do in organization, like stress management skills, yoga, all those things which organizations offer, we can only manage stress with that. If you really want to flourish, you have to apply lifestyle medicine pillars and positive psychology activities as well in daily life. Yeah. Question. After.
After he will finish, we'll start the questions and we will start the interaction.
I'll take extra 10 minutes, won't be long.
Okay.
So you understand, we don't need to only cope, we don't need to build resilience, we need to flourish. You all agree? Yeah? Unless you flourish, you can't beat burnout. So there, lifestyle medicine and positive psychology comes into picture. If you work in all those 3 bank accounts and all these pillars every day, day in and day out, you can beat burnout, you can beat chronic diseases, you can be flourishing as well. Agree? Nobody's saying anything. Agree? Yes? Yes. So again, it's not just for patients, you can use it for ourselves as well. No signal. Thank you.
في آخر سلايد اللي ذكرها الدكتور بسألكم عنه، اللي هي وش علاج الستريس والبيرن اوت. وهذه أهم نقطة احنا بنوصلها، والهدف الرئيسي من الورك شوب هذه واختيار العنوان هذا. ذكر الدكتور very important slide. You mentioned, Dr. Sunil, the last slide is very important.
Yes.
This is how to manage the stress and burnout.
Yeah.
And I will ask the audience about this, how to manage our
Yes,
stress.
I'll ask. Yeah.
Yeah. So until the slide will come back. أحد لقط شيء من السلايد الأخيرة؟ أحد فهم شيء من السلايد الأخيرة؟ وش العلاج؟
There's one question here.
قل لي، يلا قل بدون
خلك فريش، خلك شخص ايجابي، اطلع خذ لك فتره روح.
ان شاء الله اسمعك انا بس عشان بعدين اوصل.
اقول خلك فريش، خلك انسان ايجابي، اطلع روح استجمام، روح الينابيع الحاره، خذ لك فتره راحه. فدائما بعد ما تمر في فتره صعبه حاول انك ترجع طاقتك اللي فقدتها نفسيا وجسديا.
طيب يعني انت تقول باختصار اجازه، يعني تاخذ اجازه. اوكي، يعني ممكن هذا واحد من الحاجات بس في حاجات ثانيه.
ايه اكيد كل شيء فيها حاجات ثانيه.
النوم مثلا، فكرتوا في النوم؟
صح، عدل نومك، قاله من الامور اللي تسبب
النوم مهم ولا مو مهم؟
مهم.
انتم تنامون زين ولا ما تنامون زين؟
فتره الاختبارات يعني ما أعتقد.
طيب الدكتور ذكر النوم واحد من الحاجات المهمه جدا في حياتنا، اللي لازم تكون يعني بشكل طبيعي وشكل علمي جيد. كيف نومكم انتم؟ في سهر؟ اكيد في سهر، بس لا تحطون الجامعه سبب، ما له دخل الجامعه. انت وقتك والتايم مانجمنت حقك هو انت بنفسك، انت المسؤول عن نومك، انت المسؤول عن ترتيب وقتك. طبعا اكيد، وذكرها الدكتور من ضمن السليب، من ضمنه. احنا طبعا بنجي للمحاور اللي ذكرها الدكتور، بس لما سلايد. You finished the slide or not yet?
No, not yet. There's not.
Okay.
You can ask questions.
طيب وش
one question. Yeah.
Give here the mic, please.
Assalamu alaikum. Thank you very much, Doctor. As you're talking about the coping, so I just wanted to emphasize this point, because as an instructor, I have seen that now, Alhamdulillah, Saudi Arabia is moving towards women empowerment. And we all know that this empowerment has a price. And we have seen this price in our Eastern cultures and even before in America. Now, Saudi Arabia is also moving towards this women empowerment. Women empowerment means that women will be in jobs and nobody is going to take away their traditional responsibilities. They have to cope with that as well. So how, based upon the previous lessons, we can educate women in Saudi Arabia to deal with these double responsibilities and to cope with their stresses timely? Because in the end, nobody, like if you can't empathize with your own child, how you can go to empathize with the patients?
Exactly.
So I would like that how we can learn from the previous lessons to educate the new people who are coming into this. Yeah.
Same again, you have to start flourishing in every walks of life. The Medscape report, which comes every year in America, there's a gap of nearly 8 to 10%. Women are highest the burnt out risk compared to men physicians. And that gap is widening. Even though they've been doing for the last 10, 15 years now, gap is widening. So even the best of the best countries doing everything right, it still is widening. There are some factors, as you said, additional responsibilities which nobody will take away from you. That workplace stress as well as personal stress, domestic workload, everything else together makes you at a higher risk. So you have to sit down and think, do you want to work full-time, part-time, how to reduce hours, or where you want to get some help from the partner, husbands, I mean, all those things. We have to, obviously, it is up to the families to decide.
But what about like educating the ministries to develop some women-friendly policies right now, like not waiting until the women get into the burnout and then coming up with those policies and the organizations? Like
I think UK and all, I don't know much about America, but in UK they do get extra kind of a leave or a part-time jobs, and they get what you call compassionate leave, caring leave. All those things are integrated in the system. Priority is given for the woman because they know it's for them mainly. It's there. Obviously, that can be translated here as well as you. And again, you have to name it. Unless you name the problem, there is no solution. Government will not listen to you just like this. You have to name it. You have to show that there is a widening gap in burnout risk for men and women. You have to show the research or something, like you do the audit or something like that. Keep collecting data. It might change the policy one day.
We'll continue. The slide coming back now.
Okay. Yeah, this is where you were asking the question. So lifestyle medicine interventions can be effective at all stages of prevention. Primordial prevention, primary prevention, secondary prevention, and tertiary prevention. If somebody doesn't have any burnout, you can still start practicing lifestyle medicine pillars and positive psychology in your life. Why? You can reduce or decrease your risk factors before burnout starts in your life. Could be personal, could be work-related, anything. So it'll start flourishing from before it gets. It's like vaccination. Yeah. Then the primary prevention is you identify the source of burnout. It could be sometimes personal, sometimes at work. You can probably find the source and try to see if you can handle at your level. Because although organizational interventions are much more effective to reduce burnout, but to take interventions, it's a big process. So you can start from you and see how you can change that at primary level. Secondary prevention, somebody's already burnt out. What can you do with using lifestyle medicine pillars? You can reduce the severity of burnout you already have. And then tertiary is minimizing the adverse consequences of burnout. Even at that level, you can start lifestyle medicine pillars. In addition to the specialist service, you can reduce your risk and you can come back towards this side as well. Now, this is a healthcare burnout prevention hierarchy based upon Maslow's hierarchy for basic needs. Clearly, if you see at the bottom level, as long as your physical needs and safety needs are not met, you can't go higher. So you should have a good environment. You should look after yourself, thirst, food, activities, your mindfulness activities, everything, and ergonomics at work, and rest, adequate rest as well. Then safety, again, from abuse, from harassment, from physical threats, and environmental factors, hazardous exposures, and psychological harm. Unless you meet their safety and physical, there's a basic needs. You can't go higher. So if somebody is a leader in the organization here or a policy maker, you should know this, that you should apply these first rather than giving. We get yoga classes, we get all these things, which only goes up till there, social connections, meaning, and all those things. But unless basic needs are met, you can't go higher. And if you see the bottom two and the top three, they are in our hands. We can do changes more. Rather than blaming the organization or government policies and everything else, start with you first so that you can reach most of it before you want organization to help you as well. So as I told you, I think it is a triple drain. You're draining your three physical, the bank accounts which I mentioned to you. Once you're draining your bank accounts, all three of them, what you can do? You can reduce the drain, or you can become skilled in making deposits in those bank accounts. Agree? Now, to become skilled in those bank accounts, you have to use lifestyle medicine. This is work-life integration. How do you reduce the drain? Physically, you can set boundaries around 40 to 48-hour work week for yourself, or you reduce even more if you're really getting affected. Take regular 5 to 10-minute break during the work day, and take time to eat nourishing food and stay hydrated. If you don't want to remember anything from this today's talk, I want you to drink water at least 3 liters per day, even at workplace, consciously. 3 liters minimum plus extra for the weather as well. The reason is, we as human beings, we don't know how to differentiate between thirst and hunger. Every time we feel thirsty, we think we're hungry because the environment around is so much food, water is less, and we go on eating, but actually you're not drinking. If you look at your total body water, it is around 40 to 45%. Normally, which when I coach doctors, I've seen their body. But normal, what is the normal total body water, students? Total body water, how much percentage of a total body should be water? Anybody else, not only the students? 65, 70? In men, it is 60. In females, it's 55. That's normal. And what I do when my coaching and doctors, I've seen their body water 40, 45. They are not dehydrated, they are suboptimally hydrated, but chronically. What does that do? That puts you in persistent, constant stress. The cycle which you saw, autonomic imbalance and all that starts happening without your knowledge. Because in constantly in stress state, body thinks there is no water around you. That's why not drinking it. Yeah, agree? And you will feel thirsty before the anti-diuretic hormone is released. Anti-diuretic hormone reduces your urine because of you want to conserve the water. That ADH is a powerful signal for cascading stress cycle. So before you feel thirsty, it happens. So you have to mindfully drinking water 3 liters per day at work as well as anywhere you are. If you don't want to do anything at all, I request you all to drink water at least every day. Agreed? Shall we take a promise? Who wants to drink water? Yeah? Good. So decreasing mental drain, again, schedule your non-clinical time for paperwork, different times, create reminders for complex tasks, use clear email inbox regularly, reduce multitasking, use AI, whatever you want to use it so that you can reduce your work. Spiritually, make time for inspiration and meaning, read books, get involved with some people who are actually you want to look up to, and then rediscover a purpose. Rediscuss your why you joined this profession every time. And then foster your self-compassion on tough days. Now you're putting the deposits, increasing regular deposits in the same bank accounts. What will you do physically? You know this. I don't have to tell these things. Yeah. Emotionally, you spend enjoyable time with friends and family. Make it schedule. Put in your calendar. I want to do this. I want to do this. Pursue fulfilling hobbies like art or games. Schedule regular date nights. Obviously, this is for the youth I'm talking about. And volunteer to increase a sense of purpose. And mentally, what you can do, read literature, listen to podcasts, which will going to inspire you. Take educational courses, learn, upskill yourself with something different things. Have focused conversation without any distractions. A lot of time you're looking at the phone, you're not talking to people, not looking into eyes. A focused conversation helps you to build that social connection and gives you the buffer. Practice mindfulness meditation, as Dr. Michelle told you now, showed you now. Spiritually, obviously, cultivate a sense of meaning in your work. Foster self-compassion and gratitude. Spend time in nature. Develop spiritual rituals like prayer or yoga. These all evidences for the same thing. I'm not going to go through because time is up. I just want to do one more. This is very much important. Your well-being is boosted when you are with the nature. Okay. The most common epidemic we're facing globally is indoor epidemic. We are in the concrete buildings or inside the buildings. Can you guess a number of what percentage of our day we are indoors? Anybody? 96? More than 80%? Yeah. There was a survey which was taken a few years ago. It showed 93% on an average we are indoors. Our body, this machine is not made to stay indoors. We need to be out with the nature all the time or as much as possible. Yeah. In that 93%, 86% is indoors and about 7 to 8% we spend in car or transport. Yeah. So second thing I want you all to take away this thing that at least I think about 90 minutes in a week divided into 10, 15, 20 minutes, you can spend your time in nature. If you don't want to go during the hot day, go in the evening, go in the night, wherever, just be in the nature. They produce natural killer cells, which is a buffer for you as well. We got Dr. Outdoors here, Melissa, we heard about her before as well. She talks about nature and all that, so it is part of it. This is the same thing which showing spending at least 120 minutes a week in nature is associated with good health and well-being. This is positive psychology. I talked about the lifestyle medicine already. Those pillars, 6 pillars. In addition to this, you're going to change yourself for better. Just practice for 2 weeks. Don't do everything together. You can build one pillar at a time or one of these at a time. Yeah. P is for positive emotions. E is for engagement, relationships, meaning. Then accomplishments. Okay. The other thing is, if you positively reflect backwards and forwards every day. What do you mean backwards? When before you go to sleep, look at your backwards for the last 24 hours. Write 3 good things you have done or whatever happened to you. And forwards, look forward for optimistically what 3 good things you're going to do next day or next week, whatever. Keep writing for 2 weeks. There's good evidence. Just keep writing for 2 weeks. You will definitely there's a good impact on your health. Sorry. This is your self-care prescription. Take it with you today, which you already know what you have to do. Obviously, you all have your own things to add to it. Please do add, but make it as mission statement. Make it as your every day, every time you're in a different mode or stressed or not able to cope, look at your prescription and see where you're going in dips and start doing it in a better way. Yeah. So healthy lifestyle with 6 pillars, along with positive psychology, can increase your physical, mental, emotional, and social well-being to combat burnout. You all agree? Anybody doesn't agree? So please practice if you all agree. Thank you. Questions, yeah?
Thank you very much, Dr. Sunil, for this nice talk. Yeah.
Okay, thank you, first of all. Excellent. I just want to add a few things in because I think like that self-care prescription he gave you is absolutely amazing. And I think oftentimes it's hard for us to figure out where to begin. It's like too many things, right? So if you set an alarm on your phone for a couple of times a day, like maybe it's 10 a.m. or 2 p.m. or 4 p.m., to check in with yourself and just say, how am I doing in this moment? Because we're off taking care of the kids, we're taking care of our spouses, we're taking care of our patients, and then we just forget about ourselves. So a very practical tip is to set that alarm. During COVID, I was family medicine frontline. I was taking care of patients all day, all day, all day, sometimes 40, 50 patients a day. And what I started doing was doing that little breathwork practice with every single patient that I came into the room with. And I did that because I thought to myself, I have to take care of me before I take care of you. And you know what? Patients thanked me for that. So I want to just tell you that on my website, which I shared when I did my talk, wholeheartedmedicine.org, on the meditation tab, there is the breathwork practice that I did with you, but there's also mindful eating. So oftentimes, what are we doing? We're eating very fast, right? Because we have to hurry up, we have to go. But if we just slow down and we're mindful with our food, we put our hands on our table, we take 2 deep breaths, activate our nervous system to move from sympathetic to parasympathetic, that's a mindful practice, right? Oftentimes people say, I don't like that breathing thing, especially the doctors in the room, right? They're like, I don't do that breathing thing, you know, like I'm above that whole breathing thing. But the reality is we all breathe. We're just not used to feeling that parasympathetic because we're living in sympathetic overdrive syndrome, right? We're going, being chased by the tiger. And then when we're trying to digest our food, we don't even digest, even if it's the most perfect diet. So even like Dr. Sunil said, drinking your water mindfully, that alarm goes off. What do I need? Do I need to go to the bathroom? How many times do you just say, oh, I'm not going to go to the bathroom, I'm going to take care of this patient? I've set down my computer in the room and said, I'll be right back. I'm going to go use the restroom. I'm going to take care of myself. I'm going to model that behavior. Someone asked, and I love the question, how do we change the culture, right? Like the women are expected to do all the things. We have to have the conversations. That's how we changed healthcare, right? That's how we changed and we got lifestyle medicine embedded. Think about where you are in comparison to where you were 5 years ago with lifestyle medicine in this community. So I think a really important thing is just having the conversation. So setting that alarm on your phone. Should I do a breathwork practice? No, I don't like that. Maybe I do a mindful eating practice. Maybe I do mindful movement. I just shake my body, right? I shake off. What do animals do in the wild? When they're stressed, they shake, right? So there's shaking practices. Shaking breaks up trauma, and trauma gets stored in our body. And so it's very important for us to understand everyone in this room has been traumatized. Can you all agree? Every single human lived through COVID-19, which was a global trauma. And so if we are here in this room, we have trauma. We have to understand we have trauma, and so does every single person in the world that we're taking care of. And so it comes back to ourselves, like, how am I doing in this moment? So we can do the mindful eating. We can do the soft belly breathing. You may not like that. Oftentimes people with COPD or emphysema, the breathwork practice is triggering. So they do it tapping. Anybody do tapping in here? Understand tapping? Yeah. So tapping is one of those things. Relax. Thank you. Sorry. I just wanted to add some practical things. I've been doing this work for 10 years at my university, and we actually have studies of how we've improved physician well-being through these kinds of talks. So I'm so proud of you for doing this. The Physician Wellbeing Symposium and healthcare workers in general need this conversation because we need to put trauma-informed care into taking care of patients' lives and realize what we do to patients is also traumatic, right? So just having those conversations. So go on to my website. There's autogenic training, mindful eating, lots of podcasts of practical things to bring you back to yourself and just saying, how am I doing in this moment? You know, the alarm clocks are setting on a checking in. And I'm happy to talk to you about doing any of these things. I mean, I think it's really important that I'm trained in mind-body medicine. And that is one of the things I learned in my training with physicians is that we are all so disconnected from ourselves. And that was the whole emotional intelligence thing that we were talking about. Why are we disconnected? Well, because we run into a room to care for a patient, and it doesn't matter if you're hungry, it doesn't matter if you have to go to the bathroom, it doesn't matter if you're tired, you just drop everything and you focus on saving the life. And because you did that, you disconnected from yourself.
Okay, thank you,
Yeah.
Michelle, for this nice comment and intervention. Thank you.
Just one more thing, just want to add on mindful eating. How many of you pray before eat? One. Do you pray before you eat, start eating?
We pray five times per
No, no,
day.
just before eating.
Always it's before
like in Islam.
before eating. And
Gratitude,
we
yeah.
said, Bismillah.
Yeah.
Yeah, it's Bismillah to pray also. It's
Do you know why we do? I mean, every culture we do it. Either we thank farmers, we give gratitude, or we pray. Why do you think we do that? For again, students, our gut system is parasympathetic or sympathetic? Parasympathetic. It will optimally perform if parasympathetic stimulation at its highest. Okay? What we are doing, we are watching TV, we are on the phone, we are talking to somebody, or emailing, response, and eating. So what is all these activities doing for our sympathetic system? It is stimulating it. So parasympathetic is downregulated. Activation. That's why we're getting a lot of functional GI disorders now. So please take your time, pray, thank, or anything, stay with the family, eat a good meal with everyone combined together. That's one tip from me again, extra tip, do that. I think.
دكتور سنيل الحين ينصح انه لما ناكل لازم نركز بالاكل، نسمي نقول بسم الله الرحمن الرحيم، نحمد الله عز وجل على النعمه اللي قدامنا وناكل بتركيز، لان اذا اكلنا زي ما قال وحنا نكلم بالتليفون او نسولف او احيانا تسوق السياره وتاكل برجر، الجهاز الهضمي مو مركز، انت ما قاعد تركز، انت مركز بالقياده ومركز بالتليفون، فما يكون عندك هضم جيد للاكل اللي انت تاكله. لابد انك تركز بالاكل، تخلي كل عقلك وجهازك العصبي مركز علشان جهازك الهضمي يشتغل، عشان يكون عندك good gut functioning، ويكون عندك جهاز هضمي يعمل بشكل جيد ويهضم الاكل بشكل جيد ويخرجه. طيب نرجع لسلايد مهمه ذكرها، احنا تكلمنا عن ستريس بيرن اوت، ايش العلاج؟ هذا مهم، لازم قبل ما تطلعون اليوم تعرفوا ايش العلاج. طب صار كتب الله علي وقدر الله علي اني صرت بمكان يعني ضغط فيه ستريس وبيرن اوت وكذا، ايش اسوي انا في بيتي في حياتي علشان انا اتاقلم مع الستريس هذا او البيرن اوت؟ في 6 حاجات ذكرها الدكتور هنا، حاجات مهمه ودي تعطوني اياها ولازم نفهمها ولازم نطبقها، وهذه الرساله والهدف من الورك شوب اليوم، وهذا الهدف من ورشه العمل اليوم، ان احنا نطلع نفهم كيف نتعامل مع ضغوطات الحياه والستريس اليومي في مكان العمل او في الجامعه وكذا. وايضا ال6 حاجات هذه هي اساس طب نمط الحياه، وعلى هذه المحاور اقيمت مؤتمرات طب نمط الحياه في جميع العالم. يلا نبي ال6 هذول، اعطوني 6، هم اكثر بس اعطوني ال6. تفضل.
اول حاجه يا طويل العمر والسلامه لازم نسوي لنا جدول نضبط فيه يومنا، اذا كان عندنا شغل اليوم واجد. اول حاجه نضبط النوم عند الانسان، متى وجباته ومتى دنياته، ونحط عندنا وقت للراحه من مده 5 دقائق الى 6 دقائق بين كل فتره وفتره.
هذا ايش سمى كله؟ سمى تايم مانجمنت، اللي هو اداره الوقت. اداره الوقت جيده ممتازه، بس احنا محتاجين اداره اخرى، اداره مثلا ستريس مانجمنت، اداره القلق. هذه من الحاجات المهمه اللي ذكرها الدكتور لازم نفهمها. احد قاعد يسوي اداره وقت في يومه؟ احد قرأ كتاب عن اداره الوقت؟ ترى مهم اننا ندير اوقاتنا بشكل صحيح، نعرف متى ننام، متى ناكل، متى نقوم، متى نسوي رياضه، ما يصير في لخبطه في الموضوع. شكرا لك على جوابك.
Okay.
من الست اللي جابوها اللي هو الطعام تعدل أكلك، تاخذ مواد مفيدة، ما هو الأكلات السريعة.
ممتاز.
كثرة الزيوت.
ممتاز أحسنت.
والنوم بعد.
Excellent. He mentioned, I asked them actually what is the solutions, the treatment of stress and burnout. One of them, he answered the time management. That's fine. Yeah. And the second one, he told me, because I'm asking them what's the 6 or more things you mentioned here to treat burnout and stress. And this is the lifestyle medicine pillars.
Exactly.
This is the pillars we are performing conferences to teach the people and teach all the audience about them. So good, they get the message here.
Yeah, good.
Time management. What's your name? شو اسمك؟
مشاري
ايش؟
مشاري الجهني.
ونعم، وانت شو اسمك؟ ونعم والله. طيب مشاري صح؟ He mentioned another the diet.
Diet, yeah.
Nutrition. عندنا في طب نمط الحياة احنا نسميه التغذية الصحية اللي ذكرته. Good, thank you. شكرا لك. هذول الاثنين، باقي أكثر من واحد. Yes, please.
This on. Great. I wanted to just mention something. Some of you know me from before. I'm Dr. John. I was one of the speakers. One thing I haven't shared, I don't think you know, Sunil, my father committed suicide. He was a very devout Christian, and his greatest fear was that the church would find out. And he tried to keep it very hidden. He never spoke to anyone about it. And I wanted to bring this up because we do some of this work in California. I'm an OBGYN. Statistically, someone in this room will commit suicide. And that's one of the kind of pointers I bring out. And it's more likely to be a woman, much more likely to be a woman. I was thinking about some of the comments earlier. What we've tried to develop in California is a way for people to anonymously talk to someone else. And I'm curious what systems exist for that here in Saudi Arabia to be able to help people who are having thoughts of suicide or consider that. Because really, that's end-stage disease for what we're talking about.
Thank you, John.
For suicide, you know anything? Yeah.
No problem. You can answer it. No problem.
Hello?
Yeah.
Yes, just thank you for bringing up this very important topic. We have, like for trainee, if they're in the medical field, actually, they have like a hotline and access from the Saudi حياة التخصصات, what's in English?
Saudi Commission for Health Specialists.
And we actually receive as a program director and train, like, did you check with them? We have to make sure they know and the pathway. But for general population or anyone, we have like an app called Labbe, where you can just go seek medical help advice, and they have like different provider, and some of it funded by the government and some of it is free. So there is a lot of that awareness and access, and because, you know, culturally sometimes it's hard to speak. So they make sure that you get, you know, your privacy and things. And there is a lot of awareness, like every year we would receive to promote for that.
اوكي نرجع للجواب. مين عنده جواب؟ انا نرجع للستة اللي ذكر الدكتور سنيل.
من اهم الاشياء التكساس انفايرمنت، البيئه السامه اللي انت تكون موجود فيها. يعني مثلا انت لو كنت موجود ببيئه سامه والزملاء اللي معاك في العمل ما يساعدونك، المطلوب منك قدر المستطاع تحاول تسوي كوبينج، بحيث انه لو انت قادر تتجاهل ملزم فيهم بالعمل بالقسم هذا، فيه موجوده. انت تحاول بقدر المستطاع مثلا، ايوه مثلا انت تحاول تتواصل مع مثلا في اقسام انا مريت عليها از انترن، في زملاء مثلا كانوا في اقسام معينه كان توكسيك، انه يحسون الاوفرلود عليهم في الشغل، عرفت؟ فكانوا متذمرين طول الوقت. هو يحس انه وصلت لانه ناس تدعي على نفسها وهي كلها 8 ساعات، عرفت؟ لكن انت تقدر تسوي كوبينج بحيث انه انت يا تخلق new relationship in the place يعني to help yourself to management with the work، ولا إنه مثلا لو كانت موجودة في البيت ولا موجودة في بيئة الدراسة إنك أنت تلاقي لنفسك مخارج بحيث إنه أنت تكون more relaxation.
She mentioned هي ذكرت new connection. She mentioned new connection. So هذه ثالث واحدة ممكن أو رابع واحدة. مين عنده إضافة؟ في باقي أشياء مهمة.
أنا هنا.
عندك إضافة؟ قولي لي. قولي. ممتاز.
Doing the exercise and activities.
Exercise and physical activity. They mention diet, time management, new connections, physical exercise. What else?
Which table?
اللي بيجيب الجواب الصحيح الحين له جائزة.
عندي سؤال. The nutrition.
You should.
But about
you
the
should talk
nutrition
about
intervention,
hydration.
I want to ask the doctor something.
Hydration. You should talk about
Is there
hydration
any
because
nutrition
it's
intervention
taught you.
that, like supplement or
Hydration.
nutrient that can help to relieve the patient
Because
condition?
he's taught you, isn't it? You're drinking more water. No, you tell why how it has changed your life. Because
Dr. Sunil, I have questions here.
Yeah.
They asking about the nutrient and vitamins, some pills that will help in case of stress and burnout. Is it recommended or not?
There's evidence for the Mediterranean diet, where you use half of the plate with rainbow, different colored vegetables and fiber and everything. Same like nutrition prescription.
التغذية الصحية يعني.
Whole plant-based food with Mediterranean diet pattern has shown to reduce burnout in evidence. Supplements, no, I have not seen any literature saying.
Vitamins.
No, as long as you get it naturally, fine. You don't need vitamins.
What do you mean nutrient?
Which?
The pills, حبوب ولا nutrient? It's not recommended. غير موصى فيها علميا، لكن الأفضل هي التغذية الصحية، الأكل المتوازن. هذا recommended عالميا وريكومندد في جميع الجايد لاينز العالمية، سواء جايد لاينز القلب، السكر، لايف ستايل ميديسن. خذوا الفيتامينات والمعادن من مصادرها الطبيعية. You have to take the nutrient vitamins from the original source, from vegetables, fruit, and healthy diet.
Omega-3 as well, because stress leading to chronic inflammatory state, as we saw. So if you give anti-inflammatory diet, that also helps, like more of omega-3s.
انتوا قاعد تتكلمون تقولون وش الحبوب اللي ممكن ناخذها عشان اي سبلمنتس، اسمها سبلمنتس مكملات، تمام؟ فانتم من الغذاء الصحيح لما يكون عندكم، لما نتكلم عن النقطه حقت الغذاء المتوازن، لما يكون غذائك متوازن فيه نسبه كبيره من الخضار والفواكه ونسبه غنيه من البروتين والكارب، راح تاخذين الفيتامينات الكافيه، ما يحتاجين سبلمنتس. في كثير and for supplementation, it's studied that معظم السبلمنتس اللي تاخذونها الان من السوق ترى بتطلع من الجسم ما انتم مستفيدين منها، فانتم قاعدين تخسرون ما راح تستفيدون. فدائما الغذاء المتوازن مثل ما قال وشرب الماء افضل طريقه، خاصه شرب الماء. احنا قاعد نتكلم مع الدكتور، احنا عندنا تجربه دائما نسويها للطلاب طالبات اللي هو تحدي الماء water challenge. We do it every semester. Okay, and we have this table، هذه الطاولة. جربوا التحدي هذا، فبتسمعونهم بس يعطوهم التجربة اللي فرق التجربة يوم بدوا شرب الماء، يعني كمية الماء اللي بدوها كانت قليلة، والآن على نهاية السمستر وصلت إلى 3 لتر
ما شاء الله.
ففي فروقات صارت معهم، بس اذا تسمح لهم يعطون الاكسبيرينس، لانه هو تكلم هنا قال
5 minutes
انه مهمه جدا شرب الماء، لانه حيغير في البيرن اوت والستريس. اند اتس تجربه
اوكي
حقيقيه.
يلا بشكل سريع ممكن ناخذ تجربه 1 minute اللي تبين.
Hydration, we take it as an assignment from Dr. Bander. The first thing we notice that our sleep schedule is getting way better than before. Our the sweets and snacks get lower as we get better hydration during the day. A lot of things get better along with the mood also. Our focus on the
طيب خليني
classes
اسالك،
even
لما
better.
سويتوا التجربه هذه ايش لاحظتوا على انفسكم؟ المود تحسن؟
إيه.
كونسنتريشن تحسن؟ المذاكره تحسنت؟ كم اخذتوا
Well done.
طيب
دكتور
بسألكم سؤال، كيف حسبتوا الووتر تشالنج؟ يعني باي كي جي how many ml per kg you receive?
احنا حسبناه مع
3
الدكتور
liter it's not
بندر
accepted.
باي لتر.
It should be by kg. يعني الاحتياج اليومي هو how many ml لكل كيلو من الوزن، حسبتوها كذا؟
اي
كل واحد.
الدكتور بندر ما قصر حسبها لنا
ممتاز.
از فيميل واز اميل.
ممتاز.
وحطينا لنا تارجت انه خلال 5 أسابيع نوصل اذا هذه الكميه من المياه الى شرب هذه الكميه من المياه خلال يوم واحد. اي فحاولنا، احنا ما وصلنا يمكن التارجت، لكن احنا استمرينا اكثر من 5 أسابيع الان. مستمرين لتحقيق التارجت اللي حطه لنا الدكتور.
شكرا على لكن
you should tell everyone else as well.
لازم تقولون. يعطيكم العافيه. شكرا.
دكتور انا حابه اضيف نقطه.
تفضل.
تمام. حسب تجربتي الشخصيه مع الاحتراق الوظيفي، احد الحلول اللي وجدت انها ناجحه معي، تمام، وحببتني في العمل وعالجت مشكله الاحتراق الوظيفي، اللي هي جعل مكان العمل مكان باعث للطاقه والحيويه. يعني شكل المكاتب المعتادين عليه، تمام، احيانا يكون له دور بحيث انه الشخص لما يجي يعني ما يغير على مقال موده داخل المكتب. فأنا أحد الأمور اللي أنا سويتها كحل إني جعلت إن المكتب مليء بالطاقة بالحيوية.
كيف مليء بالطاقة؟
يعني أضفت فيه إضافات.
يعني
تمام.
ديكوريشن أثاث كذا يعني.
بالضبط، غير شكل المكاتب التقليدية.
ممكن.
بالضبط.
ممتاز.
فصار غير شكل المكاتب التقليدية، فمهما عانيت من ستريس أثناء عملي لما أعود أنا للمكتب أحس إني أفصل ما بين الستريس وتجيني طاقة إيجابية من المكان نفسه.
She mentioned very important. She did some modality in his office to avoid stress and burnout in the workplace. She did some. She put some plants.
Yes. Very good. Yes. Some decoration. بعض العبارات التحفيزية.
Changing decoration in the office. She feel very comfortable in the office. So to decrease the stress and burnout.
حتى أصبحت يومياً في الصباح مهما كنت أنا في نهاية اليوم السابق مثلاً كارهة للعمل أو عندي ضغط، لما أصحى الصباح يكون عندي حماس متى أروح وأدخل المكتب.
ممتاز. ترى هذا ينطبق حتى عندنا في البيت، في بيوتنا، يعني مو بس بمكان العمل. أحيانا يجينا ستريس أو بيرن أوت حتى في البيت. من الجيد إنه نغير البيت، نغير حاجات بسيطة بدون تكلفة عالية، وممكن تؤثر إيجابيا على طاقة المكان أو نفسيات اللي عايشين داخل البيت.
صراحة التجربة كانت ناجحة معي.
شكرا لكم. شكرا. لا let's start. We finish. Thank you very much. Because we have to move to the second. I know. اسمحوا لنا، يعني الكلام عن الستريس والبيرن اوت مرة ممتع ولا راح يخلص لو نقعد إلى العصر. كل الناس عندها ستريس، عشان كذا تفضفضون، أنا عارف. كل الناس عندها بيرن اوت. فالموضوع جميل والنقاش حقه يحتاج actually ساعات طويلة، لكن احنا we have to move to our second speaker. سامحونا. ممكن لو في أسئلة بعد كل الورش العمل إن شاء الله احنا ممكن نجلس، احنا جالسين للعصر. اللي بيجلس معنا حيا والله، ما عندك مشكلة. just أي واحد عنده سؤال أو استفسار أو تعليق write it down and we will discuss it later. We have to move to the second speaker.
May I invite you to raise the slogan, beat the stress before it's beat you? Thank you.
Dr. Ewan Hannes is a European lifestyle medicine pioneer, vice chair of ILMO and founder of BILMO. He co-developed the European Lifestyle Medicine Certificate, which has trained over 550 health professionals worldwide. Please welcome him.
Minutes exercise to practice summary and this. So I will start from the. Thank you. Okay. Thank you.
Even move around the tables.
Okay.
Feel free.
Thank you. Okay. Okay. So. Salam wa likun. I hope I pronounced correctly. So thank you for inviting me here. It's the first time for me in this country, and from the previous presentation, I got two main ideas which were challenging and will be discussed from another point of view in my presentation. So one is burnout, and the second is language. As you can imagine, I'm frustrated that I cannot talk in your native language. I'm frustrated that I cannot talk in my native language. So thank you for the help what I will have to facilitate this hopefully very interactive workshop. I will just, you see it's already from the beginning, but just to, okay. This one.
Try the green, maybe.
Oh, okay. Yes, thank you. So for those who've not been in Europe or in Brussels, but you like chocolate or waffles or French fries, which actually are Belgian French fries, I invite you to come to Brussels, where I am living. But a few words.
Excuse me, Dr. Ions, just I will introduce you to them that you are from Brussels. الدكتور من بلجيكا، يمكن شفتوا الشريحة اللي قبل شوي الشوكولاتة، ما يقول لكم كل شوكولاتة، لكن وش أي أفضل مكان بالعالم عندهم شوكولاتة؟ ها؟ السعودية طبعا أكيد، وبلجيكا هي أساس الشوكولاتة. فالرجال جاي من بلجيكا وهو يفتخر طبعا منتجاتهم وصناعاتهم هناك. Okay.
Thank you. So I'm a medical doctor. I'm working part of my work where I do lifestyle medicine consultation in the military hospital in Brussels. Of course, what I present here is not necessarily reflecting the Belgian army conception. And another part of my work, I work for different governmental agencies related to medical expertise with drugs and alcohol. And I also work as a in private practice, a clinical sexologist. But my big passion is lifestyle medicine, which I discovered almost 10 years ago, going in a medical event in US. And since then, I'm actively involved in the European Lifestyle Medicine Organization, where we promote 6+2 pillars. So the extra pillars are about sexual health, intimacy, and fertility, and environment. And there I'm coordinating the European certificate in lifestyle medicine. Now, in all what I'm doing and I'm working, as about alcohol, about drugs, about sexuality, about lifestyle medicine consultations, I got a problem. It's language, communication language. As you see, I'm speaking 5, and recently, since a few months, I'm learning Chinese. I said it's good for my brain against Alzheimer's, so let's learn a difficult language. But the communication, what you have with your colleagues, with the patients, that is the most challenging. I would like to know who of you like to work with chronic patients. 1, 2, 3, 4, 5, 6, 7. Okay, not bad. I have to admit that 10 years ago, when I arrived in this field, I didn't like to work with chronic patients. I felt that whatever I'm telling to them, they will do the same thing. They will not take always the medication. I tell them to eat healthy or move or not to stress or sleep better. And every time when they are coming back, they were doing the same. So I was frustrated. Until a day, an afternoon, I remember this lady who had all the lifestyle-related medical conditions, obesity, diabetes type 2, hypertension, fatty liver, and so on. We had a bit time to talk, and she started to cry, and then I understood how much is also my fault what's going on. Because when I told her to eat healthier, to move more, I didn't know to tell her more. And especially, I didn't know to listen. So that is a bit about me, but I will invite you, being an interactive, a workshop, I would need 6 tables, and you will understand later why. So I know that it's a multidisciplinary audience here, so you have medical doctors, you have pharmacists, you have nurses, students. So I would like to invite for a short exercise of 5-10 minutes to introduce someone from your table. So then after 10 minutes, in 1 minute, so the time is limited, you would say something about one of your table colleagues. So what is good in, or what is good in profession or in life, if you don't want to talk about profession, and which aspect of his life it's less good, could improve. So I will invite you to do a summary of what you heard in a limited time, and why not, maybe, to give a compliment or something that you may comment to this. So could I have some 6 tables who are would like to participate? And these 6 tables will participate also in the case, what we will have a lifestyle case. So 1 table, there are students there. I will have a help with the language. So yes. Just to have 6 tables who will participate and to talk for 5-10 minutes, and then to introduce someone of the table.
اوكي الدكتور يحتاج 6 طاولات. هناك في تمرين بيسويه هو، فبنختار 6 طاولات. تشاركون؟ كفو. هذا أول طاولة. طيب الطاولة الثانية؟ The second table here.
Yes. Oh, very good. So can participate. I saw that very, very young. Okay.
Later on. The second table, this is the first table, the second table here.
Yes, 1, 2.
The third table.
3.
The other one. Anybody from the other side?
Can be also the line, so I don't want to do discrimination with different geometric forms.
Can be line or only table?
4.
Okay, this is 4.
4. And another 2.
The 5.
5, 6. You just have to find one of your colleagues.
بالتمرين نحتاج الطاولة الخامسة والسادسة. علينا 1 2
So the table
4. This is now 4.
4. So the tables which you are already decided, just someone to discuss and to introduce them in 1 minute. So the time is very important to present someone of your group, what is good about and what could be better.
Only 4. They want
okay,
to
let's do it. Let's do it 4.
1,
so
2, 3, and 4 here. 5 maybe. 5. No problem.
5. Okay.
Okay.
So just, or maybe you already know one of your colleagues. This is why you are at the same table or in the same line. So if someone is ready, we can. I mean, theoretically it's 5-10 minutes, but and you, of course, you may talk.
10 دقائق من 5 ل 10 دقائق التمرين. You can start.
Yes. So someone, and I invite one of the table.
One
in
of
Arabic
the table
or English, doesn't matter.
Okay, we'll start with this table.
Yes,
okay.
Please. So in 1 minute, one of your colleagues, what is good about and in private life or in work, and what would like to improve or is less good. Please. Yes, yes, exactly. Please.
I interview her.
Yes, you may just tell that you interview a colleague, what is her name, and then what is good and what is not good about her, and eventually if you want to add some comments or not. Please. Thank you.
Assalamu alaikum. How are you? May I ask your good name? Name? Wafa? Okay, Wafa, can you please let me know that what is something...
Sorry, the exercise is you talk with her and you summarize what you hear about her.
No need to like have mic?
No, you don't. No, you can use the microphone, but you don't do the interview, just to have myself also a bit of job now the next minute. So it's just you do what you know about her or what you consider that she told you.
Yeah. We didn't have discussion.
Yes, if you are ready, then I can go to another table. Okay. Yes, okay, we are coming back.
We'll go to the other table.
Okay, let's go there.
So you need from one of them that he will talk with the other colleagues?
Yes, meanwhile we are walking, and then when you are speaking for 1 minute, you do a summary of what your colleague told about her or his. So I'm interested how you can do the information.
Summarization?
Yeah, summarization
How
and
to
reflect.
extract the summarization from negotiation or discussion.
Exactly. So the main idea about your person in front of you.
طيب هو شيبي يقول يصير في حوار بين أحد من اثنين منكم وبعدين واحدة منكم تصير تلخص الحوار هذا اللي دار. الحوار يكون عن طب نمط الحياة وعن ورشة العمل. تقدرون تسوون هالشيء هذا؟ يعني مثلا حوار خلينا نقول عن النوم، عن الاكسرسايز، الفيزيكال اكتيفيتي، عن الاكل الصحي. ممكن يصير في حوار وتلخصون لنا الحوار هذا.
Maybe the students already know that, so if you do a bit. And maybe the students, you know each other, you are friends, you are colleagues.
Yes.
So who would like, in Arabic, you don't have to do in English.
طيب تمرين الدكتور، انتم اليوم سمعتوا كلام كثير في الورشة الأولى، ويحتاج منكم انكم تتحاورون ما بينكم عن حاجه معينه، مثلا عن اللي قلتوا الاكل الصحي او اداره الوقت او اي من المحاور او الرياضه مثلا، ويصير في حوار بين اثنين، واحد من الاثنين يسوي لنا ملخص للحوار هذا. لا ما نبغى عن حياتك لك الله يحفظك، لا نبغى عن طب نمط الحياه. انا مؤتمر، الله يوفقك. اليوم احنا ليش مجتمعين اليوم؟ عن طب نمط الحياه، صح؟ وتكلمنا انه في رياضه وفي تغذيه وفي يعني حاجات كثيره. هالمحاور هذه تحاور مع زميلك، يعني مثلا عن النوم، كيف نومك، متى تنام، كيف جدولة النوم، جدولة الرياضه، بعدين لخصوا لنا الموضوع هذا.
So it's the same exercise what I did. I did the positive things about me, that I speak language, but I did also the negative things, that I was not good with chronic patients. I didn't like chronic patients. Yeah. So it's normal to have a balance in our life and to assume that. So, but the only challenging thing is you have to do in 1 minute.
طبعا لما تتحاورون عن موضوع النوم مثلا، اعطوني الايجابيات واعطوني السلبيات اللي في موضوع النوم. يعني مثلا تقول لي النوم الصحي كذا، النوم اللي غير صحي كذا، الساعات، نوم الليل، فرق عن نوم النهار مثلا. يعني المحور انتم اختاروه، احنا ما راح نختاره، لكن احنا بناخذ منكم معلومه. اعطيكم وقت بس ونرجع لكم ان شاء الله.
Okay,
we'll go
maybe
to
the line. So just to keep the table out.
Yeah. Hi, good morning. Did you discuss about anything in lifestyle medicine this morning?
Or you know, maybe.
You have to rest some, Sunil. This is the line starting from here.
Yes.
Just the doctor need a discussion between two persons about anything you choose, and we need from one that summarize the discussion.
Okay, just summarizing what you consider is sharing with you.
Let's go to the
It's not easy, right?
Yeah, it's not easy.
It's not easy.
Let's go to the first table. I hope they finish the discussion.
Yes.
Yeah, please. Hi, good morning. Did you finish? We need the summarization, please. We done? Good.
Yeah. Thank you.
Thank you very much. I interviewed Wafa, And she enjoyed the best in her practice that she got a chance to meet the people from different cultures, especially when she's interacting with the patients from different cultures. It's like more learning experience for her, and she enjoyed that is the best part. Secondly, in the healthcare sector, there is a reasonable salaries here, and it's a good thing to. But the problematic areas, the less comfortable areas are long work hours. The long work hours are demanding and certainly compromise on her sleep and health. Yeah.
Okay, thank you. And how do you feel that she reflected what you told her? Okay. Okay. So, sorry, was not the
That's
mic.
exactly what I told to her. She reflects me in a good way.
So you are happy that she reflected what you tried to tell her in a very short time.
Yeah.
You miss nothing that or you consider important to say.
No. I can reflect what she said to me about her.
If the next table is not ready, we can go to next table. If we still have time, then we can do. Thank you.
Continue the discussion.
So,
Maybe we'll take from
so the next table, who would like to introduce who?
You finish? You ready? جاهزين؟
إيه.
طيب.
قاعدين نتكلم عن النيوتريشنز.
تحاورتي مع مين؟
مع حسنة.
مع المجموعة ولا مع واحد؟
كلنا قاعدين نتناقش مع بعض.
Good. This is a group discussion, not person to person discussion. So give me the summarization or the summary.
We talk about caffeine almost.
Caffeine.
Yeah.
Good.
And the fast food because we didn't have the time to cook, and we didn't eat vegetables and fruits.
Okay.
So we will change the lifestyle to eat the vegetables and the fruits and like that.
Okay. And how you felt about discussion about what you did, what you tried to do?
يعني مقتنعين بالنقاش اللي دار، مقتنعين بالحلول اللي انتم حطيتوها. Are you convinced with these solutions and the discussion? This is the question of Doctor. Because they're talking about the junk food and caffeine consumption. They don't have time to cook at home. So انتم وش الحل اللي حطيته؟ انكم راح تطبخون في البيت؟ ولا وش الحل؟ ولا بتستمرون اكل مطاعم مثلا؟
وما حصلنا وقت عشان نطبخ.
ما في وقت. They said no time for cooking at home.
Okay.
So what's the solution now?
Yes. So it's a question which we don't know the answer.
Yes.
It's what we call an open-ended question, which is part of the motivation interviewing. So we had a summary, a reflection, an open-ended questions. We don't know what's coming. So we'll need more discussion to find eventually a solution or a path to go.
Exactly.
Thank you.
Exactly.
If it's still another table, yes. So
we have a
1
6th
minute.
table now. You are ready as a table now. The work exercise, Dr. Najat.
Actually, I asked one of our colleagues, what about the most comfortable things that she's doing in her life and what are the uncomfortable things? And she said that in her job, she's an academic and she likes the research part and teaching part of her job. She's enjoying that, but she doesn't like the stress that comes with the administrative work or the administrative part of the job.
And what do you think about what she told you? What would you give her, like a compliment or not? What do you think?
I believed her because I'm an academic as well, and I
Yes.
hate the same things that she hates, and I like the same things that so I can relate to what she is telling me. And this is something maybe common if you are in the same field, that you can relate to what the other person is telling you.
May I say that you admire her for what she's doing?
Yeah.
Okay, thank you. Okay. So we just got here a compliment, even if I ask with permission if I can suggest this compliment, what we translate in motivation interviewing like an affirmation. So I think we can go. Thank you for everybody participating. So what we will talk in the next minutes, it's about what is motivational interviewing. I'm not sure if there are people who are familiar with the concept. No? Okay. So we will say, what is this about? It's a new technique or it's a new therapy. The two main components, so I try to make it in a few minutes, in well, more or less 1 hour, or how much we will have, something which usually takes months of training. And then you know that lifestyle medicine, it's very confusing today. This is an alternative medicine. Is this an integrative, functional medicine? No, lifestyle medicine is an evidence-based branch of medicine, but if you want to associate with one word, it's behavior change. So how we can work with the chronic patients to change their behavior. But changing a behavior, we have to know, is our patient ready to change?
We have a good participation from the school student. Just if you will go there,
welcome.
and we will hear from them.
Why
and
they are here.
We'll consider them as a seventh table here. We'll discuss something.
So super. Who wants to be a medical doctor or a health professional
السلام
in the
عليكم.
future? سلام.
صباح الخير، كيف حالك؟ شلونك يبا؟ شلونك؟ شو اسمك؟ ونعم والله. شو اسمك؟ فيصل. ايه ونعم والله.
يا هلا الله يحييك.
شو اسمك؟
سالم علي نهير الشمري.
ونعم. شو اسمك؟
محمد.
ونعم. شو اسمك؟ ونعم. ما هي مدرسة أنت؟
انا مدري من تستخرج.
ايوه نعم. شو اسمك؟ ونعم. شو اسمك؟
هذا فايز الشمري.
ونعم. كلكم نفس المتوسطة ولا أولى ثاني ثالث صح؟ ما شاء الله ما شاء الله. الله يحييكم. استريحوا. تعرفون أنتم جايين وين؟ أنتم جايين هنا وين القاعة هذه؟ قاعة إيش؟ مؤتمر إيش؟ شو اسم المؤتمر؟ ها؟ شوف مكتوب قدامك.
مؤتمر حائل الدولي طب نمط الحياة.
ممتاز. الله يعطيك العافية. طيب شلون نخدمكم؟ كيف وش عندكم أسئلة؟ إذا عندكم مشاركة حياكم الله. تفضل. إيه تكلم مفتوح.
اليوم my name is Mohammed Badr from Tunisia. I am here with my friends. We are from عش80 school. Today we want to ask you a question. What is the relationship between the heart health and the life quality?
لايف كوتشنج. كواليتي. إذا سؤالك عن إيش مرة ثانية؟
What the relationship between the heart health and the life quality?
يعني سؤالك عن صحة القلب ولايف كواليتي وجودة الحياة. He's asking about what the relationship between the heart health and life quality. It's a good question, actually.
It's a very good question.
And we have to answer them. And because you know, the student, they should starting from the lifestyle modification from this beginning age.
So I appreciate that you come here. So I don't know if you travel from Tunisia or you are living here. I would be very tempted to tell you what you should ask me, but keep in mind that I'm listening what you ask me. So you are interested about your or someone from the family, how the heart can be healthy, so can improve also life. Yes. So you can do some physical activity to move, to eat healthy, to sleep well. So these are ways how you can improve your life quality. May I ask you a question?
Let me translate first. فهمت جوابه؟ إيه. ما شاء الله عليك. وش قال؟
يقصد يبغى يسألني الحين هو وقال لي أقدر يعني أسوي نشاطات رياضية عشان أعزز صحة القلب.
أكل صحي أيضا.
أكل صحي.
والنوم. هذا كله ممكن إذا أنت عدلته في حياتك في اللايف كواليتي في جودة الحياة يؤثر إيجابيا على القلب وصحة القلب. تمام؟ وهذا من ضمن الحاجات اللي ناقشناها في مؤتمر طب نمط الحياة. هو بيسألك الحين سؤال.
So may I ask you, what do you want to be when you be adult? What would you like to do in life? To job, like?
I want to be a doctor, middling.
And why? May I ask why?
I love these things with the healthy and شو اسمه؟
to serve people, to
Yes.
help patients.
Yes.
Okay, and
I
to
love
help
this.
the community, to help your family, to help
Yeah.
your friend, anybody need
Inshallah.
medical advice, that you will be a corner and to help him in him. طيب, what's your advice your friend, your neighbors, your colleagues in the school? وش نصيحتك دائما الصحية لهم؟ تبي بالانجليزي وبالعربي عادي،
لا،
ما في مشكلة.
نصيحتي هي النوم المبكر.
ممتاز.
وتعديل الأكل.
ممتاز.
ما ناكل أشياء زيوت مهدرجة وكثير، يعني مرة كذا في الأسبوع، في الشهر.
يصير في توازن يعني في
إيه،
التغذية،
توازن
يكون في
في
تغذية
التغذية.
صحية.
الله
عز وجل يقول وكلوا واشربوا ولا تسرفوا. فدائما التوازن والتغذية الصحية مهمة جدا في حياتنا. النوم، كم ساعة المفروض ننام باليوم؟
8 ساعات.
أنتم تنامون 8 ساعات؟ هاي وليدي تنام 8 ساعات؟ ولا أحيانا أنا مدارس تقوم متأخر شوي، بالويكند تنام 8 ساعات؟ حلو، ممتاز، كفو والله. لازم تاخذون كفايتكم من النوم، لازم تاكلون الأكل الصحي والمتوازن، لازم تسوون رياضة، تمشون رياضة الغير عنيفة طبعا. هذه تنصح به إذا إن شاء الله صرتوا دكاترة وأنت بتصير دكتور، إن شاء الله أنكم تنصحون به الناس والمجتمع اللي أنتم عايشين فيه، مجتمع أهل حائل أو المملكة العربية السعودية أو أي مكان تروح له.
إن شاء الله.
عندكم سؤال ثاني؟
إيه.
تفضل. عرف باسمك وتفضل سلم.
Hello, I'm Mu'taz Billah Hatem from Tunisia too, from Ajamid School. For my question, I need to know how can I protect myself and be healthy, and else I know how me and the younger people like me can be growing like right and healthy. That's it.
Thank you for the question. Do you consider yourself healthy?
50-50.
50-50. So what you did already to be healthy until now? What are you doing to be healthy? That 50 healthy.
Yes, I need to eat a lot of something healthy, like vegetables and other things. Yes.
Okay, so you would like to improve your way of eating, to eat more healthy vegetables, why not fruits, to be healthy. Yes. So you have actually one answer to give to your colleagues because you are doing what you actually asked me.
Yes, of course.
And what would you like to change? Because you said you have 50 that can be better. What would you like to change?
Okay, my sleep. I think it's so bad. Little. I think I need to sleep.
How you can? Tell me, يعني, what's your plan about the sleep to improve your sleep? What's your own mind?
Yes, I need
stop caffeine.
Yes, of course. It's very important.
Not to sleep at day, like after school. No sleeping, so you can sleep.
Yes, you can
early
sleep
at night.
Yes.
Not much caffeine consumption. Maybe will help you to sleep early, and you will take your enough sleeping. And you will improve your percentage from 50 to maybe 70 to 80.
Yes,
we will see then next time what you did. So thank you very much.
Thank you.
Thank you very much for being here.
الله يوفقكم. إذا عندكم سؤال ثاني أو عاد تروحون، الله يحييكم. شكرا لكم. الله يعطيكم العافية.
So,
okay, we'll continue.
Thank you. You hear from this very interesting and challenging discussion also other aspects of motivation interviewing that we will talk. So, permission. Asking permission, you would say why he needs to ask permission from a child to talk. Is the same question what we ask often. Why should I need permission to ask my patient? Because what I'm giving to them is good. I am there to fix people, to repair people. This is what I learn in medical school or in the nurse or pharmacy school. You hear also how I ask them why. do you want to do this? So it's a very simple question, and in a few minutes we will talk about that. We will say, I mean, like in a traditional medicine, we prescribe medication. So we give most of the time to chronic patient medication. In the lifestyle medicine consultation, we should give always a lifestyle intervention. Eat better, but that is very general. What exactly means? I ask him, why do you want to be a medical doctor? The another boy, what you did yourself, what exactly is healthy for you. So we will see through the SMART, if you are not familiar already with this, how we can do a very simple lifestyle intervention in a lifestyle medicine consultation. And then I hope we still have the time, we will have a small case where I invite you to contribute. So we will have 6 questions. Now you understand why I needed 6 table groups, because we will be 1 question per table. As I mentioned, lifestyle medicine, it's about behavior change. And why behavior? It's important because we live differently than 50 or 100 years ago. So those medical problems, what we have, obesity, diabetes type 2, hypertension, fatty liver, high cholesterol, are the results mainly of how we live. So we are moving less because it's more comfortable in car, or it's maybe sometimes the only one way if it's too hot outside. We are watching more TV, we are sitting more. It's easier and cheaper sometimes to eat junk food. So all our lifestyle, it's influencing also our health. So in this regard, in the years 80s, 2 psychologists, William Miller and Stefan Rolnick, introduced a communication way. So motivation interviewing, it's not a therapy, it's a different way of communicating. And one of, I don't remember anymore, but the father of one of the founders of motivation interviewing had alcohol problems. So he was also personally motivated to find something to deal with this. So this is why the first time that this communication technique was applied in people in substance use disorders, as we knew before, addiction, people who had different addictions with drugs, alcohol, or something else. And from there, we brought it in the chronic medical conditions in lifestyle medicine, because we saw that can improve the outcomes. Here, you see a person who is blind and the dog which can lead the person. So somewhere we are the dog who is leading the person. So it's not important what we think there, even if we have the best school, is what is the best interest of the person in front of us. And this person in front of us would like to change, but doesn't know how. But he tried and he failed. So when you should apply this communication technique is when we hear this word, but. I want to change, but I don't know how. But I try and I fail. But I'm working too much. So when is this word, then say, oh, maybe I should talk differently with my patient. Now, it's a new way of communication, which is a kind of summary of different, for those who are psychologists or familiar, we have different types of approaches in psychology. It's a kind of summary of that. But as I mentioned, when I know that my patient is open to change, the person in front of me is open to change. So this is why we are talking about 5 stages of change. And to be easy to keep in mind, you have in blue a word associated with that. So for example, we have a patient in front of us who doesn't want to change. Smoking. I saw that many people are smoking, so okay. I tried when I was a student well, I had a girlfriend at the time who was smoking, so is the influence there. But then I felt nothing, relationship was over, so it was good reason, and then the prices get very high. So it was 3 reasons why I stopped smoking. But many people are smoking for different reasons. So they may not be open to stop. It helps me to relax. It helps. I'm afraid to be big, to gain weight if I stop. So this person, for example, is in pre-contemplation phase. You should not insist too much because in this moment is not open to change. You may have a second no here in pre-contemplation, a person who cannot change. Talk with a medical doctor, with a nurse. You should sleep each night. You should have a good night's sleep. Yeah, but what I'm doing with the duties, I work in the night. I cannot change that. So no, I can't. It's no reason. You just lose your time if you insist on that because the person cannot change. And you may have a third no here in pre-contemplation phase always when the person is not aware of change. What's happening with me, with the patients what I work with the militaries, they are not afraid that, for example, sleep apnea, so snoring or feeling regularly tired could be linked to their sleep problems. Oh, but I didn't know that that can influence my blood pressure, or that is the reason maybe why I gain weight. But when you tell them, so you improve their health literacy, okay, I didn't know, so maybe I will do something. So we are in pre-contemplation. We may have a person in front of us in contemplation. Most of the time when the patient arrives in front of you, yes, I would like to do something with my life. Did you do something? No, not yet, but I would like to do something. So the person, it's contemplating, it's open for change, but did nothing yet. He has an intention to do something in the next 6 months. So maybe, depends on how we communicate, how we discuss, will happen a change. When the person already say, okay, but since a few days, so since a few weeks, less than 1 month, I did some change. For example, I'm hydrating, so we talk about that. I'm drinking more water. The person already started something less than 1 month and is in preparation phase. So if it's more than 6 months going on, between 1 month and 6 months, we say it's an action phase, and more than 6 months in maintenance phase. Where we can help is in one of the no from pre-contemplation. Oh, I didn't know. Okay, maybe something changed. Contemplation and preparation. These are the stage of change where we can do a difference with the patient. What is also very important is that we cannot say a person is in preparation phase. Related to what? You always need to have a habit. You cannot say, a person is in action phase in obesity. No, obesity, it's a medical condition. It's not about what I will. So it's always related to one of the pillars, related to nutrition, physical activity, and so on. Would be nice if life will not be circle. So we talked here about COVID. Many of us, we changed a lot of habits when was COVID. Maybe we did physical activity. I was one of the person, and then COVID came, and then you see the results. So I stopped doing physical activity for different reasons. So the point is that sometimes we can arrive to have a relapse. So this is why even if someone is an action phase doing for many months, we will not talk, okay, it's going on, but we may say everything is okay. This happens, for example, with people who started to do physical activity, then you have an injury, a knee one, and then, oh, I cannot do any more physical activity. Okay, I understand, I'm really sorry it's happening. What about your food? What about your stress? So we skip with the change talk what to make person to move in a good direction. This is something what I said, that it's relevant to pre-contemplation. You forgot, so, please keep in mind one of the no when it's not aware, contemplation and preparation stage of change. Now, we talked about burnout. So my colleague and friend Sunil talked about burnout. One of the reasons, I think you mentioned it in one moment, is the frustration what we may have. You have a day when you have just nobody wants to do nothing. Nobody wants to do something there. So working with chronic patients can be also very frustrating. So this is why communicating differently can help you with that. I don't know your culture. So before I came here, I look on internet, I looked some videos, I wanted to be familiarized, to respect your tradition, to understand what's going on. So I use ChatGPT, the newest version, which you have to pay for, to see what's going on here. So I did a summary of what I consider that could be relevant. So I invite you to tell me if it's something that is wrong, am I wrong, or is different?
I like that you put Saudi vision. I like the AI that give you this information in the first
line. Was the first
yeah,
line.
the first line.
Yeah, that was the first line.
This is true.
Yeah.
I think, but we have to review the others. See if anybody have a comment on this.
Or something what is missing. Yeah.
I think is it true?
So we have somewhere, doesn't matter where we live in the world, we have the same type of chronic problems. We have the same type of patients because they and us, we have somewhere the same type of lifestyle. Then it's something which we try to give them science. So this is why sometimes lifestyle medicine is a bit challenging to bring, because classical medicine, what is this? But what is this? It's behavior change. And what is also very, very important, it's much more than prevention. So we give lifestyle intervention, prescription about that. And of course, can be helpful in making you to feel more confident, and you know how to work with patients, what we call for now difficult patients. The motivation interviewing method has two parts. So has the relational, emotional part. So how is our mindset? What's going on in the communication with our patient? And we have some technical skills which already you practice here. Open-ended questions, affirmation, giving compliments, reflections, and summaries. We will see each one a bit more. Let's see what the founders of motivational interviewing saying with their words, what means motivation interviewing.
What is motivational interviewing? I mean, it's a way of having a conversation about change. And it's a particular way about having a conversation about change that listens to and calls forth the person's own ideas about whether to do that and why to do it.
One of the fastest ways that you can burn out as a therapist is being convinced that your job is to tell people to change when they're convinced not to. That's a recipe for burnout. And that is, in motivational interviewing, explicitly what you are not doing.
Why don't people change is one hell of a question. It's perhaps a useful question, but there's no single simple answer to it.
One of the things that Steve Rolnick helped me to realize was how normal ambivalence is when you're looking at a change. And to simultaneously want and not want something is perfectly normal.
So let's talk, before we do the case, about how we can, our own mindset, to make it a bit larger, how we can fight against some reflex we may have. One of the things was, and was mentioned in the previous presentation, it's about empathy and acceptance. So I accept the person in front of me. Doesn't mean that I accept the lifestyle of the person, but it's a human being I respect, and it's a person with a chronic condition which requires compassion, empathy. Now, please don't make and then we have the technical component, what I said. But before going there and trying to see if you hear that word "but" with a patient, please ask always two simple questions. As I did with the boy there. He wants to be a medical doctor. Why? Why do you want to this? Why do you want to be healthy? Why do you want to lose weight? Why do you want to feel better? And how do you see this? It doesn't take you more than 2-3 minutes, but maybe it's the first time and the person in front of you was invited to reflect What's really important for me? And this reflection is also very useful in burnout. Many people, they don't know what are the stressors. What really stressed me? I don't know what's going on. So it's an exercise which is useful in medical consultation, but it's useful also in your everyday life. I accept the person in front of me when I'm talking about lifestyle because I trust that the person in front of me knows the best what's going on in their life. I don't know what's going on there. I'm an expert about medicine, medical field, lifestyle medicine, but I'm not an expert about you, the person in front of you. So it's a kind of humility. It's also a distance that I want to understand who you are. Of course, it's not easy. It's not easy. We learn in medical school, in health-related schools, that you should do this, this, this. So as I mentioned, we fix people. We have in front of us people who are sick, and they arrive there because most of the time it's their fault. So we need to fix them. No, you don't need to fix their life. Who you are to fix the people's life. This is called writing reflex. And we must resist. We have in a health profession.
I'd like to address this topic of the writing reflex, which is a term we developed to describe something we noticed outside of motivational interviewing in everyday life. Let's take the example of a mother who's trying to teach a kid to do a puzzle. Using the writing reflex, that mother will simply say, no, don't do this, do that. A problem is seen and the problem is solved for someone else automatically. The problem is that that inhibits the learning of the child to solve the problem for themselves. As therapists and counselors, we can fall into precisely the same trap that that mother did with her good intentions in trying to help a kid solve the puzzle. So faced with a client with multiple problems, given the reasons why we went into the helping professions in the first place, it's just a short step from solving the problem for the person. And that has two effects, which I'm sure you have noticed in your everyday practice. One is, if you like, it taints the relationship between the two of you. It doesn't make for a nice constructive conversation, and it places a weight on you to solve problems for people, and they tend to shut down. The second can be observed in the behavior of your clients, which is that it doesn't lead to good outcomes. And there's reasonably solid research evidence to support that. This observation about the writing reflex provides one of the clear rationales for motivational interviewing. I'll add just one caveat here. That helpful spirit of yours, the use of that can be channeled into giving someone advice. And skillful advice giving is not the same thing as succumbing to the automatic unconscious use of the writing reflex. And how you give advice skillfully so that it's congruent with motivational interviewing, that's going to be an interesting topic, but it's not the same thing as the writing reflex.
So how we can do this? Empathy. Use empathy. There are people who are born empathic, but it's a cognitive process. We can learn to be empathic. And please don't make a confusion with sympathy. So I sympathize with something, it's something emotional. Cognitive, it's at the brain. And how we do this, how we understand what's going on, we can learn, and to be clear for the patients, we have to say it. And how we say is through reflection. Usually we use that is an attitude adherent with motivational interviewing or not. Do we give orders to the patients? We try to teach the patient, to educate, or to give advice without permission. So next to the writing reflex, asking permission is the second very challenging attitude, what we may find difficult to do this. So we ask here permission. And I would just like one or two questions here based on what we discussed now. Do you think it's in the spirit of motivational interviewing if we say this to the patient, checking your blood sugars 5 times a day is best? Is this in the spirit of motivational interviewing or not? Telling the patient what to do. No, no. Because even if we know, I mean, it's normal to do this, but the way how we say it makes the difference. As I mentioned, there are some processes. So you are still with me, empathy, writing, reflect, so that is our mindset. And then what's going on through this discussion? So we are two partners, you the medical expert and the person expert about their lifestyle. It doesn't make you to be a less good doctor or nurse or psychologist. You stay there with what you have, but you involve with the expertise about their life, the patient. I accept, we talked about that. I'm compassionate, so a patient which is suffering, who is sick, we should be compassionate about this. Should be one of the reasons why, medical field. And then what is important, we consider that each person in front of us has a little seeds of change. Let's find it, let's make it to grow. So this we can do through not being judgmental. Someone, what can I say? Someone who is, I had once a patient who was a film director and he was with obesity, diabetes, high blood pressure. And I asked him, why do you want to lose weight? And he told me to fit my old clothes. I would definitely not be the answer what I'm expecting. So, but I'm not there to judge, or at least I'm not showing that I'm judging. It's always to focus on one thing. Yeah, you should eat better, you should move more. No, one thing in a consultation. Evoking to find the motivation, and what we do in lifestyle medicine, we do an intervention. So we do a small prescription there. So I will not go because the time is limited. So when we are engaging in the discussion, please look also the body language. It's not what the patient said or how we do, or we are rolling the eyes when we don't like something. So we have to be careful about that. Focusing, I said, on one thing. Evoking how we can make. Again, I use the open questions. Why? How? These are questions which we don't know the answer. It's not with yes or no or with an item. And as I mentioned, one thing at a time. I don't want to be a bit bad or sarcastic, but we have the time. So with the chronic patients, let's not change everything, or at least we think we change everything in one consultation. Most of the time, the changes are after 3-6 months that can be implemented. So one thing at a time. And yeah, here you have, for example, a reflection which helps you. So what means reflection? You say copy-paste what the patient said. You can do it in a simple way or in a complex way. So yeah, you have here, I've been thinking to lose weight. I did some activities, but I had an accident, and then what? So what you say, okay, you don't say that, you wanted to lose weight and you had an accident and you stopped. That is not a change talk. You say, you went for a walk to lose weight. So we all stay in the change spirit. We may have the opposite of the change talk is sustain talk. Yes, I wanted to do physical activity, but I got hurt, or it's expensive, or I don't have the time. Okay, I'm sorry. It's probably difficult, so compassion, empathy. But tell me again, why do you want to lose weight? So we stay always, we go on the direction where the change talk is happening. Just one or two here. If the patient is telling you, it's really hard to stay on a strict diet. Is this a change talk or a sustain talk? The patient is telling you, it's really hard to stay on a strict diet. Do you feel that patient want to change, or yeah, no? Okay, so indeed it's no, because doesn't want to move. The 3, I probably could exercise more. Yeah, so is there an opportunity? You remember contemplation? Yeah, I could do. Depends what we will talk. I will go or not. As I mentioned, planning, it's important. We have the SMART. Are you familiar with the SMART? It's something which is used in business, but there it's usually your boss giving an objective. We brought in chronic disease where you choose something. So I would like to improve. Was there the voice saying yes to have a healthy life. We have to make it very specific, then measurable, so we can see the advancing thing there. And then which are the actions what we implement, which can come in our ways, and then for how long. I would recommend you not more than 4-6 weeks. Not in the next 3 months. It's good. Let's make it a bit, because next time we can see if it's working or not. And what is very important, like when you have someone who is traveling, of course, it's important to arrive to destination, but what you talk with the person is, how was your travel? How was your journey? Is the same when the patient is coming back. Did you achieve your SMART? No. How it went? So how it went, like this, you know the person better, and you may improve something in their life. I think we don't have the time for the case. No, unfortunately, voila. Was 6 questions, so okay, I will just go further with this and just finish the next 5 minutes. I'm sorry, was okay. So the last part, so was a relational part, motivational interviewing, and we had a technical skills. So the technical skills are 4, OARS. We use questions which are not with yes or no. So when I got trained in this, and I had an exam to get the certificate, I was so afraid not to use close-ended question with yes, no, or an item. So, but then in the end, the evaluator told me, you know, Johan, you may use this. I mean, it's not a problem. The percentage would be 70-30%. The second one, yeah, for example, just one thing. What brings you here today? Is this an open or a close-ended question? Why are you today? You may tell me that the professor sent me here. No, you want it by your interest. Okay, voila. So it's good. So when you don't know actually the answer, that it's an open-ended question. Well, we don't have the time, but maybe, so do you want to quit or cut down your smoking? What can I answer your patient? Yes, no, maybe. How you transform this, the question in an open, what do you think about quitting smoking? Why don't you quit smoking? So you understand what's going on, how, why. These are very simple questions. Affirmation is giving compliments. It's again, I would say, after the writing reflex, asking permission, giving compliments to our patient. We are not used to do that. Please. If it's working.
It's okay.
Yeah,
I can
it's
talk
okay.
about it. Actually, you're saying that we are not used to give compliments, but I have learned what about Saudi culture. They are very good in giving compliments.
super.
Even when you start the first interaction with them, they will say so many afiya, salama, like so many compliments and always appreciative. And this is what I like the best about this culture, that they will always create a room for you there where they will appreciate you. Yeah.
Thank you very much. Thank you. So I will go on this because it's nothing to add here. This is why it's so great to know a culture and to reflect what is on that. And we are out to reflection. So reflection is the best way to express that you understand what's going on with the patient. And here, you see, I'm not sure that my blood pressure is always so high, so I don't take always my medication. How we can reflect this? So the blood pressure, what we read today seems unusually high for you, because maybe in your home it's okay. So we do copy paste, that is called simple reflections, but be aware what you reflect. So if, for example, you have often a very minimalized situation, the postpartum depression. So many women after giving birth, they may suffer of depression which is not diagnosed, and you may hear this, I feel such a terrible mother. So the reflection simply will not be, oh yes, you feel so a terrible mother. No, I mean, that will not help the change. So Here, which answer of you consider that would be the best reflection? You shouldn't feel like a terrible mother, you are a good mother and you are doing the best you can, or you feel like you are not meeting your own expectation, that you are not how you would expect to be. Which one would be the best reflection? First, you are telling the patient how to feel, even if your intentions are good, but she's feeling not good. Is the second, you feel like you are not meeting your own expectation. So you are not feeling good. Because you just reflect what she's saying. But if you say, you are a good mother, no, she doesn't feel like that moment. It's not easy, I know easy, and our intentions are good when we do this. But it's just another way, it's another language to learn. If you know the person better, or with some experience, you may use what we say complex reflections. So that, for example, I'm only here because my wife sent me to you and she thinks I have a problem. The simple reflection will be, oh yes, your wife sent to me. Okay, will this help to change? No. If we say in a complex way, so you feel that you're not understood, that you don't know why you are here. Oh yes, so you are empathic with what the person feels in front of you. Sometimes, I have often, as you can imagine, military are not always very communicative. And they are men, so we don't talk too much most of the time. So what you do with this person? So we are looking the body language. I'm feeling that something bothers you. Am I right or not? I have the impression that you are not much interested, but maybe I'm repeating you something what you know. So these are also the non-verbal behavior. Or you may have offer, smoking. It's not a big thing. My father smoked all his life and he was 100 years old when he died.
Excuse me, Doctor. 5 minutes.
Thank you.
Thank you.
So then you have to stay, always change talk. This is what I have in mind. So I not say, oh yes, your father lived until 100 years and it's good to smoke. That will be the simple reflection. So we have a bit to modify, what happened with your father that really challenged most of the people who smoke, what's happening with them. And finally, summarizing. So in the end of the consultation or in the end of an idea, we should always summarize. And you saw at the table, you are doing, and was intentionally 1 minute because we don't have much time when we are in a consultation. How challenging is to summarize something? But I asked your interviewed partner, how do you feel? And she said, no, she reflected well what I said. So summarizing helps to reflect, to give the patient the idea that, and the reality that what said during the consultation. Sometimes you may close a discussion, or when you have in the next time, you may link with the previous consultation. So we have different type of summaries. But the main idea is please do always a conclusion of what you said. For those who are interested, you have the 4th edition, is the last one from 2023 of Miller and Rolnick. And you have also in diabetes care, so they are a bit seniors as age, but they are still active, prolific. So if you are interested about that. And then, what's references, and it's always involving. I hope that even if it was short time, I succeed a bit to challenge our reflex, our mindset. And thank you very much for.
Thank you. Thank you. Thank you very much. Shukran jazilan. As you mentioned it in your slide.
Yes.
Shukran jazilan. Thank you very much, Dr. Aywas. And we are very happy to have you here in Hail, and you give us a very informative presentation regarding motivational intervention. So we'll open the floor for the questions, or if you want to ask some, it is interactive session. So if anybody, we have 5 minutes for interaction, and we will move to our third speaker, Dr. Brighton.
Maybe I can challenge.
Yeah, it's okay.
If it's,
no problem.
or if someone wants
challenge,
some
ask, and you will be asked, and that's
yes, yes. Which is the medical condition that is the most challenging for you?
ما هي الحالة الصحية أو المرضية اللي تكون أكثر تحدي بالنسبة لكم؟ This is the question.
Yeah. I mean, you've been student.
Some they're answering cancer.
Cancer, okay.
Okay. الأورام. الأمراض المعدية أو البانديميكس. Infectious.
Okay.
Yeah.
Infectious. Cancer infection.
ما هي أكثر
psychiatric patients, something specific in psychiatry, depression, anxiety, or no?
Which one?
Chronic, okay. Okay, because in depression, anxiety, burnout, we can still do this. Some other conditions are outside. I mean, lifestyle medicine, it's not a miraculous solution, what I say. Certain cancer we can help, certain infectious disease we can help, but not
حد
in all.
بيضيف ممكن؟
Yeah.
ما هي أكثر الحالات والحالات الصحية تحدي بالنسبة لكم؟
HIV patient.
كيف؟
HIV patient. It's
HIV. Okay, HIV patient.
HIV, okay. It's also not an easy, not easy. There it's very important to take their medication, for example.
من أي ناحية HIV تحدي؟ هل هو من ناحية التثقيف المجتمعي، أو من ناحية العلاج، أو من ناحية حياة المريض
يكونوا هم
أو
أصلا
المصاب؟
نفسهم مش متقبلين اللي صار لهم ويحسسوا إن it's the end of the life.
تحدي اجتماعي قصدك؟
تحدي أيوة. يكون تحدي إنهم هم مو
لكن
متقبلين.
ممكن هو المصاب ما عنده تحدي، يعني يتعايش مع
احنا هو لما سأل سؤال قال احنا كممارسين لما نتحدى مريض يكون صعب بالنسبه لنا، صح؟
اوكي. لا
أيوة.
ممكن يكون تحدي المجتمعي او تحدي نفس الشخص او
هو
تحدي
نفس
للممارس الصحي.
صح. هو بالنسبه لهذا هو الشخص، حتى لما انت تيجي تعطيه ادفايس او something انه ممكن في يوم من الايام انت تشفى او شيء، هو ممكن يتجاهلك لانه لا انت not in my position، عرفت؟ not in my situation.
She said that we have a multiple challenge here. There's a social challenge for the HIV patient, personal challenge, and the challenge to the health care institution also. So a different challenging.
Exactly,
for the
but
HIV.
maybe it's medication, one of, if I may say this, medication, which is actually a challenge for all chronic patients. Please, before adapting the medication, consider that half of the chronic patients, they don't take regularly their medication. So I always ask them, look, do you take your medication, but immediately empathically, because sometimes it can be very tiring to take every day, or did you forget sometimes? And if you do yourself the test, you will see that 1 in 2 patients, they don't do that. So let's adapt that. Okay.
There is also, as you mentioned before, for the postpartum depression. This one also is the most we are seeing in our life.
Which one?
Postpartum depression.
Postpartum depression. Yeah, that is something which we should give space to talk and to, as was there, to say that the fact that they are women, as you probably know, they hate their children because it's postpartum depression. So that it's a very serious question which should be given the opportunity to talk. And this is why you may ask even a simple, what bothers you today? What is your biggest problem today? What do you feel? How do you feel there? And she should bring you. Most of them bring you because you are really open. You are really interested what's going on. This is what we can do. It's very easy to make easy. Between chronic tiredness and depression. So in the morning, how do you feel in the morning? If you feel tired, but you still have the energy to go for your everyday life, it's mostly chronic tiredness. If you have no mood to go in everyday, even things what you liked before, then you may think about the depression.
Okay, so
thank you.
We have cancer, we have HIV challenges.
Nobody has
postpartum
diabetes.
depression. And what about chronic disease?
Lifestyle
ما حدا عنده
related.
تحدي بالسكر.
ischemic heart disease.
ضغط.
Ischemic heart
Ischemic
disease,
heart
cardiovascular, yes. Was that one what you said, or? Sorry.
يعني because it is the leading cause of death and because it is the outcome of all the lifestyle challenges.
Again,
sorry.
Victor?
The ischemic heart disease, I said,
ischemic heart
it
disease.
is the leading cause of death.
Yeah, exactly. So here what is related to lifestyle, it's usually high blood pressure. So there is always, you know that it's called the silent killer. So most of the time we don't feel that we have that. But we can see when we talk about nutrition, what is about your salt, and again, how is your sleep? Do you snore? Do you feel regularly tired? Because it's something which we don't look enough for it.
We have type 1 diabetes mentioned here, and especially with the children challenge. Type 1 diabetes.
What is really challenging for you when you talk with the patients? I understood there are some people who like chronic patients, great. They are better than I was 10 years ago. But something which is coming up with, because it's about communication. No?
ما هو التحدي تجاه الممارس الصحي مع المريض؟ أكثر شيء تحدي بالتواصل مثلا الكوميونيكيشن. وش أكثر تحدي؟ هل اقتناع مثل الاقتناع؟ Convincing. They're having challenge when they convincing the patient.
So this is why next time
إقناع المريض.
Why did you came in consultation? Yes.
يعني I will tell you my story with my mother. She was a diabetes patient. When I want to ask her to be in the diet or to take her medication regularly, she refused. يعني I am a nurse and I have two nurses on my sisters, but always she not listen for us. She always said, okay, if I be in the diet, I will take the medication. It's not gone. The diabetes will not go.
How old she is? كم عمرها؟
Now 51.
51. Still young, but
51.
she's refusing any
refused
recommendation.
Because she have this disease before 20 years.
And she said,
خلاص, it's my destiny يعني. Don't told me not to eat sugar, be on the diet. So hard, and she was my mother and she listened to me. What about the other patient?
So in the family, of course, I think we all know that giving advice, we are the son, daughter, that it's not easy. So that is also one thing which can express. But I would definitely ask first, since she has diabetes, did she change something?
And what?
I don't know, eating differently, moving, or she's just taking the medication?
She take her medication.
Okay.
I will all the house be diet with her because she sometimes we bring sweet for the home. Maybe she feel I want to test it because that all the house we eat everything without sugar. يعني we be in the diet with her to not feel any differences between her food or us. But she still feel I am all the time. She still feel I am the sick.
Since when she has, if I may ask, diabetes?
20 years.
Yeah.
20 years.
20?
She have disease?
Yeah. How many? 20 years.
20 years.
Yeah. Okay. But look here, it's something she's probably in pre-contemplation. She doesn't want to do nothing because what is change? So here we can boost, and that was thing which we had no time to talk, but chronic patients, they have very low self-confidence because you live with something every day. So there you said, look, I understand that you don't want to change something, but you already did a lot of things. You are taking regularly your medication. Look, we eat differently in the house. So thank you for taking care about you because you can be there for my children, for your nephews and the family. It's great if you do this. I'm wondering if giving compliments, being really grateful for what she's doing to stay longer with you is not something that can make her to think twice. So you get out of your fixing with all your best intention, your mother appreciating what she's already doing for...
sometimes we told her like that. If you will be more healthy, we be grateful for you because you will be stay with us a long time. And when she do something like sweet or something, we eat it because she still want to feel she have a purpose as a mother to cooking to us. And we help her. And sometimes motivation is helping her to deal with her disease. And really, the non-therapeutic, it's helped with her too much. Because, you know, some people with a chronic disease and see other patient and other family. My grandmother, she died with the diabetes, and it's in the family from the side of my father and my mother. And she's scared too much. Because that when I told her the medicine now, it's alhamdulillah technology, everything is good, we will help you, we will take care of you, she felt more rest.
Fear, it's an internal motivation, can be paralyzing, but what she's already doing, it's like when we're gaining weight, we are happy if the patient didn't gain weight, it's on the 0 level. So here she's keeping doing this. So her way of dealing with this is her best way, but at least she doesn't have complication. So Lucy, so the point is they are not miraculous solution what we do here. It may be in one moment that you have something in mind, and as we know, it's moving something or sleep that you may talk in one moment. But for now, and or will require more time to see what really motivates or not her, she is there on the 0 level, going on with medication. And as I just mentioned, 1 in 2, they don't take it, and they develop complication, and then even they arrive even worse. Depression is something often associated with chronic patients. So if I may say that, I will leave her for 1 month. I will say nothing, just great what you are doing. And it's curious to see how she will react with this new attitude that you don't try to fix her.
Just motivate. Just motivate.
And appreciate what he's doing.
Don't advise, only motivation. I think this is the solution.
Thank you for sharing this personal story.
Thank you, Dr. Ron. Well, I think we will move to our third speaker.
Welcome with me, Dr. Brighton Cherika, Primary Care Leader, International Health Consultant, and Certified in Lifestyle Medicine. Welcome, Doctor.
Thank you.
I appreciate
the point. That's the pointer.
Go forward. Skip the slides.
Okay.
If you need me, I'm here with you.
Thank you. That's right.
Translation.
Is this working? Okay. So forward is this?
Yeah, this is the forward.
Okay.
This is back.
Oh, back. Okay. Good.
Good luck with you.
That's fine. Salam alaikum.
Assalamu rahmatullah.
Could we come forward? Because most of you are at the back. Do you mind coming forward, please?
ممكن تتقدمون اللي ورا في طاولات فاضية هنا بس علشان يكون في تفاعل أكثر. يا شباب تعالوا هنا قدام. بليز ولا اخواتنا اللي بالخلف في طاولة هنا لازم تتعبى. Okay, they will come.
Okay, thank you very much. So I just want you to, this is going to be interactive again. It's not a lecture, it's a workshop. So what I want you to do is next to each other, can you talk to each other about what is the best thing that has happened to you today? Talk to each other about what is the best thing that has happened to you today. We'll give you a minute to do that. And then I would ask 1 or 2 volunteers to tell us what is one of the best things that has happened to you today. Take the minute talking to each other, reflecting on one thing that has happened to you today. There are so many things that has happened to us today, and we need to just take that moment to reflect, to thank God for whatever has happened in our lives. Because sometimes we always think that life is negative. We look it in the negative side. But there's so many good things happening in this kingdom, which we need to be are proud of. Who has got the mic, please? Someone wants to tell us what's the best thing that has happened to them today. Thank you.
عرفتوا فهمتوا السؤال؟ يقدم.
The best thing that is happened for me today to meet my friend, because long time I didn't see her, maybe more than 1 week. So today I met her.
So thank you so much. The best thing is to meet your friend. You have not been meeting most of the time, but today, because of this, thank you to the organizers. Some people actually are meeting their friends in this conference, which is something good. We are connecting. We are strengthening our relationships. Yes.
For me, when I be here in this conference and listen for all this information, it's good for me, and I have more knowledge than before. Because that, I'm very grateful for everything I have today and meet the odds.
Amazing, amazing, amazing. We learn every day. We keep on improving. We become a better version of what we were yesterday if we come to these conferences and learn a lot from others. And we become better and better. The day we think that we know it all, that's the day we die. Do you mind?
You have answer.
I will speak in Arabic.
Yes, please.
My mother tongue is not Arabic. So, قولي الحمد لله أنا موجود اليوم. I am alive. I'm grateful and thank you for being here. Without which I could not be at the Live 80. I am alive and Live 80 at Hail. Guli Alhamdulillah. I'm so thankful, without which I could not have met this awesome people on this earth from Hail. And I thank everyone who was in the process of organizing, for getting together, all the hands, the minds, the brains, the souls, the intent. It is incredible. Thank you so much for a patient listen. Dr. Mukta Subhash Kute from King Abdulaziz Specialist Hospital, Sakaka. It's an appreciation. We just have a museum nearby, which is 50 steps away. It is Nebritas. It talks about the 100 years journey of the ministry, where they talk about a journey which started on a mat and a few doctors who were treating the people who are coming for the performance of their Hajj. And Guli, insha Allah, ida fi moka, if I have a chance, I will go, if not in the land itself, because of the religion, at least when I fly over Mecca and Medina, I will pay my gratitude to the one and only one. Thank you so much.
Thank you, thank you. Amazing. On that note, do we have the scientific committee? Any members of the scientific committee stand up? Any members of the scientific committee, please stand up.
أعضاء اللجنة العلمية خلوكم واقفين لو سمحتوا.
Members of the scientific committee, please stand up.
أعضاء اللجنة العلمية خلوكم واقفين. طلب من الدكتور. أعضاء اللجنة العلمية خلوكم واقفين في طلب من الدكتور. Please. يعني.
We have heard the appreciation of the great work that you're doing. We also want to stand up and appreciate them. Let's stand up and appreciate the scientific committee for the great work that they are doing, that they've done.
الدكتور يقول أعضاء اللجنة العلمية أوقفوا وطلب من الجميع التحية لجميع من يعمل في اللجنة العلمية للمجهود اللي قاموا فيه. شكرا لكم. Thank you, Britain, for this complimentary. It's appreciated. Thank you very much. I appreciate it. Thank you.
Okay. Thank you. I just want to share with you a story that changed my life. And in this story, I want you to pick up one or two things that you may also learn. By the way, I'm a general practitioner, originally from Zimbabwe in Africa. And now I went to the UK for 2 weeks in 2000, and I'm still there 25 years later in the United Kingdom, where I'm now a primary health care physician, and we look after patients. We've got a list size of, I run 2 practices. In one practice, we've got 10,000 patients. In the other practice, we've got 11,000 patients. My experience with one patient made me reflect, made me to think, made me to realize that sometimes we may be harming patients unknowingly. We had this gentleman who was coming regularly all the time to the practice. He was seeing different doctors in the practice. He saw me, he saw X, he saw Y with recurrent abscesses, recurrent balanitis, which is infection of the private organs. Now, each time he was being given antibiotics, after antibiotics, after antibiotics. And then one day I thought, oh yes, I'm the better doctor. And I did some tests. And believe it or not, he had unbelievable worse diabetes type 2. And I said, yes, I got the solution. I gave him a medication. Come back in 3 weeks, in 3 months' time. He came back in 3 months' time. The diabetes was actually going up the control. I gave him a second course of medication. See me in 3 months' time. He came back in 3 months' time. I gave him another third medication. On the 4th visit, I just realized that I was missing something. What is it that I'm missing on this gentleman? Sometimes, as practitioners, we need to ask ourselves, what is it that I'm failing to understand about the person in front of me? I've got my own doctor agenda, but sometimes we need to listen. The expert on their life is the person who is living their life, not you who has been in medical school and think you know someone's life when they are only seeing you for 10, 15 minutes. So when I sat down with this gentleman, he started crying because what I did was I said, I've got the time. I listened with curiosity, listened with fascination, listened to understand, listened to empathize, to put myself in his shoes and not walk in his shoes. Sometimes when we listen and empathize, we then try to minimize people's experience. No, you can't. That's not painful. I've had worse pain myself. No, let us see things through the lens of those people that we are looking after. He then told me that I've been lonely for 5 years. But some people think loneliness is just because you are alone. No. Loneliness, you can be in this room with 20, 30 people, but you'll be feeling lonely. It's that craving of human contact. He was having that. So what was he doing? He was comfort eating. He did not have time, as has already been said, time to cook, time to prepare food, and was not bothered. So what did he do? He would go, this shocked me. And when I spoke with him, he gave me the permission to keep on talking about this experience because there's a lot for me to learn, and I hope you're going to learn 1 or 2 things from this story. He told me that breakfast, he goes to McDonald's. Lunch, he goes for Burger King. Supper, he goes to KFC, Kentucky. And that was his life. So you may give a lot of medication, but medication cannot fix lifestyle. And lifestyle on its own can work well, or you may need to complement it with medication. So when we spoke with this gentleman, and something amazing happened, and Jessica, stand up, please. Dr. Jessica shared with us a story of someone special, someone dear to her, who had their diabetes reversed. And I can also vouch to say diabetes in this patient was reversed. We stopped all the medication. But as you know, life, he also had some challenges here and there. But I can safely say today, he's being controlled on one medication, and his diabetes well controlled. Thank you, Jessica, for that. So this has taught me a lot, and I hope when we are faced with patient in front of us, we will be able to reflect. So today, this is the final workshop. You'll be pleased to know, and after this, you are released. So just bear with me for a few seconds as I go through this. Yeah. So what we are doing is we are bringing in what has happened from Sunday up to today, and then take away something. It's pointless to come to this conference and leave here without learning about what you can do about burnout, without learning about what you can do about motivational interviewing, without learning about what you can do about shared medical appointments, without learning about outdoors. So I hope you take one message today and then we move on. So knowledge is not power. Knowledge is only power when applied. Good intentions are not good enough unless applied. So the word that I want you to remember as I go through this workshop: action, 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 action. And now I want us also to understand that lifestyle medicine is no longer an afterthought thing. It's no longer an additional or an extra. It is the foundation. So those who are in medical school, those who are in training, if you are not being taught about lifestyle medicine, tell them that at the conference we were told that it should be part and parcel of our training. Wherever you are practicing, if you look at all the guidelines, they start by lifestyle. But I don't know why we miss it. We don't talk about it. So today the message is lifestyle medicine is foundational. And as Dr. Sunu told us, you can use it to improve surgical care. You can use it to improve even ICU care. So there's a lot that is happening in this kingdom that I'm going to share with you that you should not think you are starting from scratch. You are miles ahead. And I'm going to elaborate on why I'm saying that. So do we have the speakers that spoke this week? All the speakers that spoke this week, please stand up. All the speakers that spoke this week, kindly stand up. The speakers that spoke this week, kindly stand up. You have the mic, please. I just want 2 of you or 3 to just say one message you want the audience to take away from this week, from this conference. Just 2 or 3 of them to just say one message, 10 seconds. Don't take my time, please. Yes.
You are a very powerful person to influence your patients to adopt prevention and lifestyle medicine.
Amazing. One message you want to share with the audience so that they take away something.
Yes, your health is your choice. Choose to be healthy.
Thank you. Dr. Aldo. Okay, and Michelle.
Aim to be 1% better each and every day, and it's never too early or too late trying to lead a healthier life.
Thank you.
Ask yourself, how am I really doing in this moment?
How am I really doing in this moment? Am I above the line or below the line?
And I would just say, keep going. You've already done so much. So every step is a step in the right direction.
Amazing. In this kingdom, we appreciate to be appreciated. People appreciate us. So I think there's a lot that is good that's going on that we need to scale up to appreciate. That's why I said to the scientific committee, well done, we need more of this.
So the best way to know a person is to open the heart to that person. And this is what you did here with your culture. So thank you.
Amazing, amazing. Is to welcome, to open. In Africa, we say friendship is complemented by sharing food. And I've enjoyed the food here. And especially yesterday when we went to that traditional home house.
Yeah,
the
the
food,
historical house of Alabeda, yes.
amazing. Because if you, in our culture, if you don't give us food, you have not welcomed us.
It was all the traditional food
Yes.
for Hail. You know some names of the food yesterday? You get some names, you
remember?
You remember some names? They didn't tell you?
My memory is letting me down.
Yeah, okay,
on that
I
one.
tell you. أمس رحنا في مكان تراثي فقدموا لنا أكل تراثي. والأكل التراثي المعتمد في منطقة حائل إيش هو تعرفونه؟ الأكل التراثي أو الأكلة الشعبية المعتمدة في منطقة حائل. كبيبة. مكشوش.
مكشوش.
Yeah, مكشوش. You tried yesterday مكشوش.
Yes, I did.
كبيبة.
Yeah,
رغفان.
Wonderful.
This is the most delicious
What about the one that was
food
with olive
الحائل.
leaves?
أمس كلوهم
Yes.
كلهم. كبيبة.
I love that
مكشوش
one.
and رغفان and قرصان.
Do you have some at the moment?
You try.
Do you have some at the moment? I want to hear for something.
إن شاء الله. Today we can bring you. يبي كبيبة ورغفان زيادة اليوم إن شاء الله. Okay, thank you.
So I hope that by this end of this session, we will have covered a few things, shared medical appointments, and we are going to use a methodology called appreciative inquiry. There's something that we need to understand. The knowledge, we may have knowledge, but what we do in our practices is different. So I hope by this end of this session, we are closing that gap of what you know and how you're going to apply these things when you go back. So the problem now is no longer lack of knowledge. That's why I did ask all the speakers to stand up and give you the knowledge again, so that no one says I don't have knowledge. Now we've got the knowledge, but the gap is action. Are you going to apply it? Some people that it's for doctors, no. It's for nurses, no. It's for students, no. It's for everyone, from leaders up to the students. We are all called to action to do something about this. So I want you to talk to each other. What is it? That's something that you know about lifestyle medicine and you are not doing it. Something that you know about lifestyle medicine and you are not doing it. We are not going to ask you why. So don't be afraid. I'm not going to ask you why. But I just want you to tell us something that you know about lifestyle medicine and you are not doing it. Anyone who wants to share with us? Yes, Doc. Do you mind the mic, please? Okay. You can use your voice if you would. Yes. Yes.
Not to have enough time to sleep.
He knows that he must have enough sleep, but he's not having enough time to sleep. Anything else? Anyone wants to share with us something that you know about lifestyle medicine, but you are not practicing it? Yes, Michelle? So,
finding more time for silence.
Yes, so people like Michelle and myself, we can talk for Africa, United States, Europe, and Middle East. So we need to be, we might not have time for silence because we've got so much to say. So it is important to have that time. Thank you so much. So when we look at appreciative inquiry, we are looking at what is working well in the kingdom. If you look at the palm tree, if you focus on its leaves, you might think its leaves are dry. But if you focus on its roots, and you nurture, you water the roots, you get nutritious dates, and I love the dates, and I'm enjoying the dates here. It's just amazing. So this is one thing that if you focus on something good, if you focus on something good on some person, your positive expectation of someone, they will do good. So in the kingdom, you look good in one another. You look something good in one another. You know that Allah, God has blessed this person. Let us appreciate what they are doing. So that is why I've chosen this appreciative. I'm appreciating what is happening in the kingdom. Because sometimes we come with this negative to say, you are empty. Your cup is half empty. No, 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 no. There's a lot that is happening, the good that is happening here, that needs to be scaled up. So I hope you come out of this place proud of yourselves, knowing that you can improve, you can get better, but you're already doing great. So what you're going to do is you look at what is the desired outcome. I want you to use this in your life. What is my desired outcome? What are my strengths? What am I good at the moment? And then I want you to dream about the future and then do what we call back from the future thinking. Okay, I've dreamed of this kingdom being the best in the world for lifestyle medicine. And then now we say, okay, how can we reach to that dream? We are now designing. And what are the low-hanging fruits that we can apply? So that is appreciative inquiry in short. When we look at our pillars, we talk about food. In the appreciative inquiry, we look at the values and strength in the kingdom, the culture, the oneness, the appreciation, the looking of good in each other, the meaning, the motivation that we have, self-awareness. And this kingdom is a kingdom of hope. We are always hopeful. We are not negative-minded. We are always hopeful. And then empowerment. And I like what I saw yesterday. When we went to the other side, I saw the community, people engaging, people being empowered. And I said, yes, when patients are activated, when patients are motivated, when patients are empowered, then lifestyle medicine is now not a thing to add, it's now life. It's now part and parcel of us. So this is what we are seeing happening in this kingdom. Relationships. We value relationships. We value our community, our togetherness. We eat together, we sit down, and I like it when we have, you roast the lamb. You put it in a dish. You put the rice. And then we all sit together, start eating there. It's amazing. It shows togetherness. If I am able to put my fingers and eat with you, I'm trusting you. I'm not thinking you can poison me. You've got poison in your hands, you're going to put and then you kill me. No. By me trusting you, I'm putting my life in your hands because you are my brother, you are my sister. So that is one thing that we need to continue taking advantage of. Substance misuse, we talk about identity and behavioral change. So in your pairs, I want you to talk to each other. When lifestyle medicine has worked in your community, because I'm not talking in your clinic. Yes, if you want to share with us in your clinic, fine. If you want to share us in your university, fine. If you want to share with us in your home, fine. So let us share when you notice lifestyle medicine worked well for you. What made it strong? What happened? Who made it possible? What were the things that made it possible? Anyone who wants to be brave enough to share with us? Because if you look at lifestyle medicine, we are talking about nutrition, physical activities. We're talking about stress management. relationships. Yes. Absolutely. So it worked well when we went back to basics. More. Yes, Jessica. Amazing, amazing. I think this idea of thinking that we can, yes.
You want me to repeat it?
Please.
Okay, so we did a school-based shared medical appointment, and so it worked really well because we had the school principal, we had the family medicine residency from the university, we also had families, and we also had students who were all engaged, and we did this program for about 9 months, and we changed the lives of our families. We lowered A1C, we lowered BMI or obesity, and also the children really learned about how to prevent chronic diseases. So it was through community and it was through families and partnerships that made lifestyle medicine work.
Amazing. Partnerships. So we are hearing partnerships. And in the kingdom, partnerships is part and parcel of our culture. Working with schools, working with other, in the past, you'd have doctors saying they know a lot on their one side, but here we are saying we are a team. In Africa, we say it takes a village to raise a child. And I want to say it takes a team to run a medical system, to run a healthcare system. You need pharmacists, you need physical activity specialists, you need nutritionists, you need dietitians, you need student nurses, you need doctors, medical students, you need everyone for that system to work. And the lifestyle medicine, that's what it does. It embraces everyone, it brings everyone together. So we are hearing that when we worked as a team, do you know one thing which has been found even on Google, one of the best companies you can think of? It is not about the expertise in your team, but it is about how you interact in that team. Imagine in your ward round, if the consultant is full of himself or herself and is arrogant, he does not even listen to anyone, the care in that team is going to be mediocre. It's going to be poor care. But when everyone is humble, when everyone respects one another, because sometimes it will be the student who say, Prof, you have left a scissors in this person's tummy. But if the professor is full of I know, you may remain quiet and they are suturing an instrument inside. But we need that psychological safety where we feel we belong. We are welcomed, we are included, we are known, we are respected in that team. So that's what we need to know. And also where I can admit our mistakes and learn from our mistakes. And where we've got the freedom to speak, to contribute, and also to say, I've got a better idea. From the conference, I learned this. From Jessica's speech, I learned this. From Kelly's speech, I learned this. Can I share with you? And the people are open-minded to embrace your contribution. And when we talk about openness, we are not saying take everything. Even what I'm saying here, I just want you to be open-minded, listen to it, and then decide whether this is some things you can throw away, but some things, but what I'm saying, take it, all of it. Take everything that I'm saying. So when you are open-minded, you listen, and then you decide what you're going to take or not take. So we have heard. So some of these things that can help us is good protocols, partnerships, listening, leadership, and all this that can help us to run our lifestyle medicine clinics. And I don't think it's only a clinic, it's actually in your home. What are you doing when it comes to preparing food? So what we do in our homes, we want to translate it into the system. We want to make sure that all these little things that we are doing in our homes, we can take it to the whole system in the kingdom. System thinking, we want to have supportive structures workflows and aligning culture and leadership. We don't want to talk about health eating and then around the place here, we have got McDonald's, KFC, Burger King, everything around this place. We're actually making people fail. Some of us, we've got what I call eyeball hunger. If I see food, I eat it. So right now, when I pass through that side, I have to be appreciative of we have a serving and I want to also to eat. And there are people also comfort eating. When they are sitting, doing nothing, they also want to eat. They want to use their stress, to use food to address their stress. So we should make sure that our environment does not make it impossible to do or to practice lifestyle medicine. So we need to understand lifestyle medicine is not a program. It is the system. Structures, behaviors, everything. So all these things has been covered this whole week. I'm not going to repeat this, but what we are learning is that whichever area, even fasting, ICU, surgical, everywhere we are talking about lifestyle, outdoor activities, everything, we have got that. So the message is lifestyle medicine care is not an occasional or an extra or an add-on, a top-up. No, it is a system. It is foundational. We need it for whatever we are doing. So I like the vision 2030. I'm not going to repeat it. We know it in and out. It's talking about proactivity, prevention. It's talking about how we manage chronic diseases, how we keep well. And now, one thing that fits well is lifestyle medicine. And I'm happy that this conference is addressing that. So as you have noticed, we have heard this week all this keep well system, health setting, digital tools. We have been told about epigenetics, the hardware, the software, updates, and all that. We have been taught about this week. So we have, knowledge is there. The gap is application. So as we move from this, we want to make sure that we are applying. There are domains of how we can implement this. Number thing, everything rises and falls on leadership. And I'm actually impressed that the Crown Prince is part and parcel of this. So you're getting leadership from the top, empowering you to do what you're doing. This is an amazing. If you ask most of the countries, do they have that leadership from the top? And most of them will tell you no. But here is something that we want to appreciate and we want to commend and we want to say thank you, the Crown Prince, for what you're doing in this region. And I'm also happy that we saw even secondary school students, they are being exposed to lifestyle. Medical students, nurses, they are being exposed to that. So we need to make sure that our workforce is trained. So you want a workforce that is competent, that is trained in lifestyle, that knows their roles. And then our clinics, the digital, the networks, and the community. We mustn't forget about the community here. We are a family. We are people of faith. We are people who can humble ourselves. Because when you fast, when you can deny yourself of the food, you can control anything. If you can deny yourself, food is there, plenty of it, but you are denying yourself that. That's self-control. Then to me, I want you to learn and say to yourself, if I can do that, what can stop me being a person who can live a healthy lifestyle? Culture and leadership is at the best. And I'm happy I'm talking here because we have got it. So when culture and leadership is in alignment, you start having workflows and team roles. And then we can also talk about data innovation, whatever. But without culture and leadership, because they say culture, eat strategy for breakfast. You may try to do anything, but if your culture is not aligned to what you're trying to do, you fail. But here, there's some that we need to be happy and realize that we've got richness in this culture. So now I want us to dream the ideal lifestyle, medicine, clinic, community, kingdom that we want. So I'm going to ask you to go into sleep for a year. You're allowed, but no snoring, please. Sleep for a year and then wake up next year. You see this whole place amazing. Whatever you are, I want you to tell us, what are you seeing after that dream? What are you seeing that has happened? All the international speakers, you've gone back. And you are coming back next year. Something amazing has happened. What is it that you're seeing? Even at your university, you've gone to sleep, you wake up next year, something amazing has happened at your medical school. At your school, you've gone into sleep, you wake up, something amazing has happened in your school. What is it that you're seeing? What is the patient experience? What are people feeling? All this. So I'll give you 2-3 minutes to dream, but don't go to sleep. Just a nap, dream, and then let's talk. It's difficult to predict the future, but you can predict the future by inventing it. How do you invent the future? You dream about it. When we were young, at high school, teachers would ask us, what do you want to be when you grow up? And we said what we wanted to do, what we wanted to be. If the teacher was very good, they would make you dream larger, dream bigger. But some teachers I know, they would do, are you crazy? Are you mad to think about this? But I just want to let you know in this one, you're allowed to dream bigger. If your dream does not scare you, you're not dreaming enough. So what we are seeing in this kingdom should scare you where we have reached. Okay, so let us now share our dream. Just what is your dream that you are seeing next year? Yes, please, go ahead. Can you have the mic? Amazing.
I would love to see less fast food outlets around us in the city.
So after a year, all the fast foods have just disappeared. And now we've got health foods around us. Thank you.
I want to see my patients coming ready for change.
We have got activated patients, patients who are motivated, patients who are empowered, patients who are telling you, look, my app is telling me that my blood pressure has been high like this. So, doc, what should I do? They are working in partnership with us. Amazing.
Do you have a dream? You're still dreaming. Okay. Yes.
To open my own clinic.
Amazing, amazing.
Good.
And then let it be so.
Excellent.
That there's not unnecessary financial burden or constraints that keep our patients away from us, deductibles, co-payments, things like that.
Amazing. Access, affordability. Patients will just be coming to see us without these challenges of saying, oh, how are we going to pay? And also, I'm not really happy for you to come to see me when I'm not going to be paid and all that. Those trends will be gone when we reach our dream. Jessica?
I would like to see America adopt some of the things we've seen here in Hael with a systems approach. You got literally doing some great things here and have lifestyle medicine be the standard of care.
Amazing. You see, there's also one thing that we think that we are coming from UK, we are coming from USA to tell you what to do. No, 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 no. We are coming here to exchange notes. We are coming here to do what we call reverse mentoring. We are learning from the kingdom some of the things that we are seeing here, we are going to take them back and say, where I was last week, where I was at the conference. When I was at the conference, I saw this. As we were walking last night, we saw you can just start exercising your hands. When we were walking last night, I saw you could go on a treadmill just in the street doing that. It's amazing. We just want to give you a round of applause for the great work that's being done.
Sir, my dream is to see life medicine will be taught in all medical schools.
Amazing. Every medical school teaching lifestyle medicine. That's the dream. And it can be done.
After I see the very comprehensive lectures about lifestyle medicine and in different disease, I dream that I feel that lifestyle medicine should be a school protocol, because if I have 6 pillars and I want to start at a cardiovascular patient, he is diseased, I feel that it should be integrated during the school when they born up, they learn about healthy nutrition, physical activity, good sleep. Then it will be more protective and effective and facilitate our role. If a physician at the clinic, I have 20 minutes, it will be difficult to be in his shoes and know his lifestyle condition. It will be facilitate our role.
Amazing. I think let's give you a round of applause. I think it's no brainer. It's common sense. But common sense is not. Yeah.
If you allow me, Britton, thank you for this question, because I'm happy to hear this all dreams, especially that dreams that you take the حائل experience to your home back. Appreciate this dream, and I hope it will be, and I'm very proud of this dream, actually, that حائل will inspire all of you to take your experience here to United States, United Kingdom, Algeria, Egypt, Sudan, and all over the world. And it's my honor to hear that from you. Thank you very much. Thank you. It's my proud. This is the one.
You are making history.
Yeah,
you are making history.
We are making history.
You are setting the pace.
حائل making history.
Yes. So
1 minute.
Yes. So when we refer, we'll be referring that high.
Inshallah. Anyone having another dream? Please, Mel.
So my dream is that as clinicians, when we're seeing our patients, we're not just telling them what they should do, we're showing them how they should do it. And that's through teaching them how to cook and teaching kitchens. That's taking them for walks outside, that's connecting with nature, that is showing them how to, track their sleep and how to optimize their sleep. So integrating the how into our visits. But first of all, we need to know that first as clinicians, and so lifestyle medicine is a pathway to train our students, our residents, and our non-lifestyle medicine physicians, but really integrating the how.
Amazing.
Excellent.
When we look at the how, we look at what is in your hands. Because sometimes we want to tell people what to do. Dr. Hens told us, reminded us, we should not tell people what to do. Let us look, what is in their hands? Where are they? Are they pre-contemplating? Are they contemplating? Where are they? Meet them where they are. Use what they have in their community. Use their culture. Use their activities. Use their life. Because if somebody says, well, I've got children, so I don't have time to exercise. And then, do you take your children to the park? Yes, I do. Do you run, or you'll be sitting on your phone and the children are dancing, are playing there? Why don't you join in them, playing with them? Oh, that's a good idea. So you see that it becomes easier. These things, when we talk about them, it becomes common sense, but we don't do it. So we need to make sure that in our dream, this becomes easy. So I'm just moving. I like what this, I've borrowed it. Okay, Michelle, go ahead.
I was just going to say that every human being on the planet can experience a sense of peace and calmness in their mind and their heart and their bodies, so that the whole world knows how that feels, so that everybody can continue to roll that out to the world around us.
We are carrying a lot of trauma. We are carrying a lot of frustrations. We are carrying a lot of pain. But we need to have time to reflect, time to look after ourselves, time to see where we are. Are we above the line? Are we below the line? What can we do? In our business, can we take time to breathe? Time to go on holiday. Time to be with your family. Time to play with your children. Time to talk to your partner. Time to talk to your mom. You see, in some communities, I've seen, because when I went into the UK, I worked as a healthcare assistant whilst I was writing my exams. And I was so close with elderly people. And they would tell you, I wish if my son or my daughter could come and see me. You only see the daughter when that patient dies. They come and collect a few things that they want. And I just want you to imagine, it's you in your 90s. No one is visiting you. No one is coming to see you. Would you want to live that life? Because we are speaking of increasing the life, increasing the years, but we also need life in those years. It's not about increasing the years, it's about increasing the life in those years. The quality of life in those years should be something that, not that you are enduring old age. No, you should be enjoying old age because you are living a quality life. So there's the reason for being, and I want you to help me in Arabic. Which one do we use? In Africa, we use Ubuntu. I am because we are. In Japan, they say ikigai, the reason for being, where you find something that you love, something that you're good at, something that you're going to be paid for, and something that the world needs. When we find something that fits all those four areas, something that you love, something that you're good at, something that you can be paid for, something that the community wants. And when you look at lifestyle, if you're good at teaching or practicing lifestyle, and you're good, you love it, you can be paid for lifestyle. And also the world needs lifestyle. So lifestyle medicine becomes your ikigai. And I want it to become your ikigai from this workshop. So exactly, lifestyle medicine becomes ikigai. I like what Sami Bet said. I've borrowed his image, say it's amazing. So lifestyle medicine has to be easy. By ease, we are saying it's EASI, which means it's empowering, it's affordable, it's scalable, it's impactful. So in the kingdom, it can be affordable because of the way the health is funded here. But can we scale it? We want whatever's been happening in her to go out to Hafri Abotin, to Riyadh, to all these places coming from here. That's scaling. It has to be impactful, looking at the outcomes. And can we retain it? Can we engage? So now we are coming to the end of our session. We want to look at shared medical appointments. I just want to ask the audience, how many have practiced or have been in a session of shared medical appointments? How many of us have had? So it's good. If there are only 4, so at least we are going to talk about something that you are not aware of. Good. Yeah. So we add value, but there's a lot that we are taking from the kingdom. So we're going to add something to this.
5 minutes, Dr. Breton.
Okay.
5 minutes.
All right.
Thank you.
There was an. Okay, that's fine. So this is a structure. If you want to put something in operation, you've got our screen assessment, the brief interventions, team visits, referral pathways, and all that. This is when you want to put your theory into practice. So, for those, I'm now rushing a bit, but there will be, I would ask 1 or 2 people that have run practice shared medical appointments, they would agree with me that there's efficiency, there's patient engagement, there's also peer support, there's interprofessional teamwork, because in the same room, you have got a dietitian, you've got a physical activity specialist, you've got the doctor, you've got the pharmacist, you've got the physiotherapist in one room, and the patients are there 5 or 10, or even go to 15, depending on the situation. You can do that. So I want us to think, because of time, think about this. Just check the slide. Think about what you would want in a shared medical appointment, and what you can do. So I'll just ask Kelly, Jessica, Michelle, to just quickly, 1 minute, tell us more about a shared medical appointment, what you'd want, what your experience on that, yeah. So that when we talk about this, we're not talking from theory, we're talking for people that have done it.
Well, shared medical appointments are a wonderful way for patients to have access to care, because there's only one of all of you, but sometimes there can be multiple patients. So if you can get them all together and talk about whatever the topic is, condition or different lifestyle medicine interventions, it can be time-saving and cost-effective. So there's so many benefits to shared medical appointments.
Amazing, amazing. Thank you very much, Kelly. Jessica?
And just to add to that, I've done them for diabetes in particular. So usually it's 8 to 12 patients. You don't want your groups to be too big, but then there's usually a nurse practitioner or a physician, a dietitian, and a health coach. And more recently, we've also added in community health workers who will specifically focus on whatever the topic may be. So many times for diabetes, it's nutrition. And then the provider will see the patient for maybe 5 to 10 minutes to check in. They may need to adjust medication, but it just depends on what's needed. But like Kelly said, shared medical appointments are a great way to see more patients, provide community information, and they also learn from one another, which is a great thing. Thinking back to the loneliness piece in the group setting, it's just not the provider who has the knowledge, it's the patients, it's the people who are sharing, it's a community.
Sometimes patients are afraid or fear to ask questions. So in a group medical appointments, oh, that was my problem. I wanted to ask it. Oh, yes, I thought it was just me. What's side effect of medication? There's this aha moment that happens in these clinics.
I would just say that pick a thing that you see the most of and make that your first shared medical appointment. On my website, which is wholeheartedmedicine.org, under the resources tab, I have videos on how to do it and really to just dive in. And so, it could be for anything: osteoporosis, sleep, hypertension, diabetes, teaching kitchens, going grocery shopping, reading food labels, whatever it is. Menopause is a big one, men's health, any PCOS. So just pick something and just start.
Amazing, amazing.
I'm going to echo exactly what Dr. Michelle said, and utilize your whole team to do this. So this could be run by health coaches, dietitians, nurse practitioners, physician's assistants. We have people who help us scribe and document so that the person leading it is not having to document during that. And we conduct our physical exam just by interaction. So just by talking to people in the room, you are assessing their physical exam. You're seeing how they talk and how they breathe and how their mental clarity. So you don't necessarily have to carry your stethoscope and do a full body exam. So just by documenting that, and we've had great success. And like Dr. Michelle said, pick a topic and then just go with it.
Thank you so much. Because of time, I'm going to move on to the designing. We can design the clinics that we want. We've had the resources are available from the college, American College of Lifestyle Medicine. You can get a lot of, and also let's network, get contacts of people here so that you can contact them one-on-one. Technology, we are using it. Just one message for technology: do not focus more on data leaving the patient. You should understand how that patient is living. Don't just say, oh, your blood pressure is high, and then you're just focusing on that. Like what I was doing. I was just focusing on the figure of HbA1c. I was focusing on it instead of understanding what's going on. This person is eating Burger King, KFC, and all that, but I'm focusing on trying to reduce medication. So we have to be very careful when we focus too much, because right now we might have a lot of data, but please, we are still needed as humans. We need to be compassionate, to listen with curiosity, to listen to understand, to listen with empathy, to listen to be moved to alleviate the suffering of our patients. Not to do things for them, but do things with them. Dr. Sunu spoke in detail about looking after yourself. When you go into a plane, they will say, put your oxygen face mask first before you can help anyone else. Lifestyle medicine is for you and for your patients. But first of all, it's for you. Use it, be empowered, and then empower others. You cannot give what you don't have. You can't give compassion when you are not compassionate on yourself. You cannot be kind to other people when you are not kind on yourself. Look after yourself, because you're the only one that we have. You're our doctor. We want you. So I want to find what is one thing that you're going to take. Just one thing. Take one thing from here. What is the one thing that you're going to take? Are you going to start clinics? What is that one thing that you're going to do? What are the barriers? Yes, there are always barriers, limited time, unlimited training problems and all that. But to be honest, we have been fed. We have been taught. So what is now left is applying. Let's go and apply it. The vision. We have got this vision, which is showing us the direction. What we just need is to start moving, because already the scientific community has taught us we can move. So the barriers, I'm not going to talk about the barriers. We have covered them. I want to remind you, I've brought this slide again for a reason. Now, I'm asking you, what are you going to do tomorrow, within 7 days? So, what stood out for you on this conference? And why did it stood out for you in this conference? So what are you going to do? That's food for thought. Write down what stood out on this one. Why did it stood out? So what? Tomorrow, I'm going to start walking after every meal. Tomorrow, I'm going to start doing this. Tomorrow, I'm going to start doing this. Then if you can do that, then I would say the conference has been a success. So this is your plan, action plan. So the future of healthcare is lifestyle medicine. It starts with compassionate leadership, where you listen to fascination, listen to understand, listen with empathy, listen to be moved, and work with your community. The future of leadership in the kingdom starts with you. Don't point to anyone else. It starts with you. It starts where you are. Use what you have. Lead from where you are. Because one lifestyle medicine action, if we all do it together, will change this whole community. Thank you.
Thank you very much, Dr. Breton, about this very nice and informative workshop. We learn a lot of things, and we will start doing our plan for tomorrow, for next week's, for 30 days, and for 1 year. I'm talking about myself. I will write my plan, don't worry. For tomorrow, this Thursday, so my vacation will start, inshallah. And I will sleep well, because I'm very exhausted from the conference.
Yes.
This is my plan for tomorrow.
Amazing.
For 1 week, I will take a vacation for 1 week. And for 30 days, I will see another objectives, inshallah. In my vacation, I will think about another objective. This is my plan.
Wonderful.
And you have all write down your plan and share it with us. Thank you very much. Thank you, Dr. Burton. Any question, quick questions? Because we have to finish the sessions. I know you are tired, but it was very informative workshops. really we learned a lot of things from Dr. Sunil, Dr. Hans, and Dr. Britton. Thank you very much for all of you. If you have quick questions, we will open the floor for just one question. I think we cover everything during our workshop.
Yeah, just summary. Yeah.
So just if anybody having comment or question, or we'll close now. Okay, just we will go for 2 minutes honoring part, and we will go home, inshallah. See you tomorrow. Thank you very much.
Thank you.
Thank you.
I would like to invite all of our respective workshop leaders on stage for honoring Dr. Sanal Kumar, Dr. Ayn Hans, Dr. Brighton Sherika. First? Sanal first, then? Dr. Ayn Hans. Dr. Brighton Sherika. That's all for today. Looking forward to see you tomorrow. Get sleep well.
If you want a group photos on the stage, no problem. The stage is yours. Just go there and we will take a photo. Anybody want a group photo will come here. Anyway, we have still 2 more workshops tomorrow morning. And if nobody traveling back home, we'll see you tomorrow morning, inshallah. And today, إذا أحد حاب يشاركنا الصورة الجماعية يتفضل، حياكم الله. الستيج كبير، اللي حاب يشاركنا الصورة الجماعية يتفضل.